Assalamualaikum badingolu ngal kontong mobe dawda anibe watu watito. Kontun bro kolans Bismillah na programo ming kasunodang lokong loko ninyan tambensida civic education governance sky power radio and TV services studios West Yorkshire streaming from back home in the Gambia. Mustafa Jame my name at this seat. Banil Lomodalin Jiberal Kalbe Kontong Kal Bismillah na programo ming kasunodang lokong ninyan tambensida civic education. Yo, I'll feature Sky Power Radio and TV Studios Western New Little Bismillah Session Bunch program civic education and Asen Harit Mustafa Lekavan feature Rajabi. Butung data kaya kanya loko ninya meme for wolong so correct kadia wulo fangal dakon. Wakamala kala.
Yeah, Mustafa is streaming in Gambia, so network connectivity. Yeah, since we are live already, I just probably take temporarily and then he comes back.
Bamol hakedan lo wala bake purkal hakilo blandiko mbe Gambia le anu Gambia internet connection idara dawda even the best ni ko the best the most expensive jama hani water moro abuka sonea but bemol hakedan lo wo short break means the water internet connection but now manje you can keep on talking. I'll be in and out depending on internet connection or banyameng yang. Okay, coming to being alo nyamen. So be na kasha ko jama kala minna bayri sokore ka dia wolo fangal da ko se mol be bula e fang killing introduce new bora jen sina dum kasha ko mafalal ko ladies first mimbe mol jati ba olon day jobade day and they budung se bula ni mol ñoo kontong new bora jen sina dum kul kono ladies first day.
Hansa di Luntangola, di Fatula and Kadi and the Dr. Nyol. Yeah.
Okay, F Baji, is a more content.
Baraka back in day and Mustafa, assalamu alaikum, Gambia, Ngalbe Kontong, fellow panelists, good evening. Telem Fatu Baji, survivor of FGM, Dunta Nyaka Tole, Bairi Nyaka Tota Kuombo, Kacha Kanjang. Ngamira important telepuru people like myself nga fintinang fanangan na version no nyingfo nga na experience share the based in UK janne I'm a feminist ngamira tol jamalian lonne keno kono musol la nyantole kele mbedamin jang UK jang tata nyaka tole bari fanan ni musol do ko kele men ya lon ko tata nyaka tole so I'm very happy and privileged to be here. By the end of the conversation will be kachanying benyo konoto dialale Dr. Olben Fejanne momo e mellong e bo folale and nga hope le ntefanam be fenkaran na janne bari fanam na experience o mba shayalal ala baraka.
Ini bara ke F bayi burung sina itu ya
Kadi
Abaraka Mustafa, Abaraka Ndei Fatu, and panelist will be now. You come right about.
Yes, Kadi.
Yes, go ahead.
Okay. Okay, into Tom Kadi Barolti, into Panama Gambian Olti, into medical practice, I'm a physician associate in Bay State in Janne, United States, began for so many years. Into Panam, Nyaka, women, carpet, into Panam victim, let in Panam Tara through this FGM Lala. As long been Nakachabe, Mobelula, usol nyaka tala defana nga nyaka experience le nata meddo ko la medical field ko no ngaaje ko ni nyaka pol aka mol tora nyame defana na bi kanani pengoto jang kanani penko soto jang tun defana nga na ideal be ka tala ka se ani molu ngamen loni nyaka ko to ani mol la jada kende abunda nyo soto nyame so ala baraka ba.
Assalamu alaikum, telam Yankuba Sane. Inte Gameno Mumpanati, University UK Jane, Cambridgeshire. I shouldn't actually be here because it doesn't kill it in FGM monkey victimity, obviously. But Kanaka, a medical perspective, I think that is a decent responsibility. And I thought to come and say or highlight some of them coming along. I'm not a gynecologist, but as with any surgical procedure or any intervention, common complications and the rare ones sometimes they surface, or sometimes you could not even imagine will happen, as will happen on occasions. Natal Prungajibe, so along the way, Fingol Mini Nata, model them highlight, I will try and see what medical complications can arise, and not only medical, psychological, sometimes social, and even mental health associated complications. Near arise, I will see how best I can address them. So I am hoping ala baraka.
Yeah, mbakula ala barka albe ntol katara janne be molbe kontona na luntangol kadi F and Doctor as well. Mbalbe welcome na ni platform every Saturday len katara jang ka different issue bi o manke political ti bi mo cool member experience ntelem day jobate nte fanan yes nga mo victimolity FGM and nearly ndingo fanan nearly keta victimolity and no need to kacha kono mbabe explain la fanan so bi kacha be kela woleti talking from a victim's perspective bangol bafula molka ni nyin call for molka tara inen na leka call for but ni mun fanan na koleti na adolem ta kono len da kono ala barka ba kembe Suleiman ning baba mas fanan konton na bele katara jang bal be konton na ala barka
yo jërëjëf Ndey maa ngi la nuyu ni la santa di nuyu Moustapha di ko santa di bëggee suñ gan yi di leen nuyu di leen santa ku nekk sa tur ak sa wàccuwaay Bamba Mass moom it maa ngi ko nuyu di ko santa. I hope ne tey moom he would have a lot to contribute. Like Doctor said, okay, ñun duñu victims, why we come from backgrounds yoo xam ne you know family bi dañ ko dee practice, and then you know comme li nga suñ doom yi is like protection bi we have to do it to protect leen, why there are instances yoo xam ne survive, some of them they have to go through the process. Waxtaan bi is going to be very interesting today because it's a very gray area and it's trending at the moment, and gis na a lot of the public and political leaders are avoiding the topic. This is what we call a difficult conversation boo xam ne dina ruffle the feathers of certain groups and individuals or organizations in the society. But however difficult it is, we have to discuss it, we have to talk about it so that we can look at it, on either side, on the pros and cons, and then the viewers would be left to make their own decisions as to what they believe and lan lañ cee jëlee or liñ cee sànni. Jërë ngeen jëf.
Bamba ibije
Sulemana baraka bake mbadiŋolu mamira nin sato be diamuta alkalo labanta o mu kayrol folo mbe mbari musol be welcome la Fatou ani Madame Baro Fatou Badji ani Madame Baro mbal welcome la na brother fanang Doctor mbe welcome la mbafule ko welcome to this platform. Jangde civic education lemu nkanyoso hakilo la watu dobe, it's very contentious nkanyosa babake katu surtout nin dunda politiko kono al ñabe ñi menay ja classo dunga kantela copy bari alon hani baro fa ko Ousainou Darboe copy so mbuka o ke problem ti bari al salon ko jang ne aliyem moy wuro la ñokunna behind the scenes we are always brothers and sisters there is nothing personal ntol nga ñoo jëla kon tol le mo bakilim fakiloti bayring alayen tol le de Gambia la so woton si même fo no Gambia no le drombe kachaame kala jang akachabe dulale bare alisa lom fanan ko mbelaf la pour ka ñoso londol la nimmenu bala moy la dukara la moy hakilo la alkana jusota koto kato ntenga nyi ko je nyame modol ka sika nyame asikeno modol heart attack soto modol asikeno janne dipitol fawol be loi dala modol be falale because woluka sike sise jusola nyame amanyan na kela wo nyama nyi mo feneti me alon ko londo nyanta nyina la jele pro nsa kachano nyame bajela ko ngaben on common grounds asatara modo de modo baramala modo de modo banen na waranka modo kajafa kola ala baraka bake ngamira Mustafa te be Gambia le alba wo understand la fele wato do be karandun la ka fundi ngamira ndol fon nyanta ko kajala de because Gambia internet on tamalo fo e pipe fon le kuntu bande mal sa ko karawta bak wala ala baraka bake everybody atol la moy lalu atol le kumaya tan tolti wotal si karim ka fo hatelo la alla comment section oldo min nimmem faransin kumandino al sen kumandino ala baraka assalamu alaykum wa rahmatullah.
Yeah, just another addition fanang for Nagesol. It's like a monkey, you would wait for your time. If you feel you need to interject, is it interject no? So sometimes when you hear someone is saying something you want to buttress, is he jump in, or if you have a question, you can just come in. So you don't have to wait for your name to be called to contribute.
Yes, thank you for that. And then okay, Mustafa is back. But I think Fatu, if you take us near through FGM Nyimfangola, the practices and the types, Mekake Gambia.
Abarakande. So nyaka tutamen kake Gambia. Ngamwele moja malko FGM bukake. Ngamira we start with terminology and then go into the different types. So moja malko circumcision lekake Gambia, female circumcision, but FGM bukake Gambia. So until men dunta nyakato, until Jamal bije nga lonne ko FGM lekake Gambia. Minem FGM ti. So nga fo ito la circumcision, ito la circumcision describe nyame, ito ya ninke wala asi hakotunye, ya ninke wala kase ito ta ya ni wale compare, ya ni wale kunna taki. Wala ne kaya ko female circumcision. And wale follow kabiri nga nyaka tota research dati. That's how they used to refer it to. Female genital cutting wala female circumcision. Because ya ni wo keta le na kendi nyola. What time mo kisi role manke follow, what time mo among to follow international attention or to follow, imagine follow the impact aka menke mantorol jata kende ala karola aka menke musola. So molka kumandi wala. Nita the different parts of dunia kono. Dula dul bije ka fine sunna wal buka fine FGM. Dula dul bije wal ka fine kitan different tool le bala sate o dula dunia dula beto. Bari menka kento la Gambia FGM lam katu WHO la definition ay men fintindi ko walem FGMT wala ka kentol ya wala nyin type nanoti type 1 walem niatara ko yemusola nyatoto alse hakoto nyabayri karandirombe wala fonse kuol bondinyo kono dono musola nyatoto temanko menka kije ka fume ko clitoris niedo mandin talaje wala ya be bondi walem type 1 andun Gambia wo kakije tol nsafu ko Gambia mo jamal bije ika waleke ibuka a pricking ke doron ka foko ntol kamen foko sunna ka do manding prick je yalon pricking fango kunturo tije wo ikatale ko ika sole wala ka do manding comme ni twisa ta ye do manding chopoti santo wolem ntol kamen foko sunna man itol yemem mira ko wala kake bari wo buka ke type 1 skin ka bojele clitoris nyinka kuntule completely wala do manding bondije yena type 2 jibe type 2 wala me alon ko ibe clitoris nyim bondila yena inner lips fanam bondi wokan inner lips doctorol bijanne inner lips walen musola musiyato konoto fato yo fananta yo bondi ye santo to bondi ye konoto fato fanam bondi type 3 dol bije type 2 nyim fangoto ka kono to fato bele bondi dol bije ka domandin talaje type 3 wole meya lon ko ni sukiroke dol bije se kono to fato bondi ye na nyim bantala fato ta ya kara nyobala dol bije ise borolta meya lon ko ni dundi nyaka to be sukila wole fe pour ni be kende yakan ibalo ni we suki nyola andu wo fanan kake Gambia karalo ka kijetole nyin sukirol ka kijela musu jamal bijal yalo ne ni be dundin kanna ndel be mu victim oti wakono ni be dundin kanna ike mabuka kunoyma because of munem ye sukirole ke ibe sambala ngan simbale ya ko tenke yeta wo sukiro bonde dol bije dum isafu ko wasiata nyin west letter mo isa pricking nyinke wala ye fenke musola musu yato me ya lonko aman jata kende ay makai for the purpose of medical reasons comme amanke ko yake le pour ay jata kende ya soto jeto whether culture dol bije wol kaje janile dol bije wol kaje scrape le wala dol bije nyin tultata nyarandiri fengoli ka wala ke musola musiato ni o fananke wo fanam type 4 FGM let so ni ajibe Gambia kabri ya kisi rol ke ya jeloko Gambia Bureau of Statistics wale wo kisi roke musu wili tanning fula 12,000 women idiamuta wale wo 12,000 women ol kono 73% be type 2 ya wala soto nata ko kemo kemeleng taworo wala ning saba wo be type 2 ya wala soto al hekato type 2 17% wale type 3 soto wale ning sukiroti and womu good proportion of musola moti 12,000 people wo Seattle woto sila nintol ko nyaka to ta membe Gambia wo musa circumcision leti comme sunno ka Kenya men abentol jahallale bayri intol le dunta so nyinlem nyaka to ta different types of men ka kijeto ntol la Gambia ji anda manke ko fenneti me ya lon ko yen karandalale fengole me ya lon ko tol la fango nga experience
abarka Fatou Fatou Nisa explain them because katu gal katara confusing ne ka foko nyaka to ta type 2 and type 3 wo bu katara Gambia so pour ka gena explain ko type jamal lebe katara Gambia ika malpractice
type 2 bijeto le wole fango siata kay bayri nga nyimmen fo ni di amuta mosole ko keme o keme ta wora wala nin sabo be ko atela type 2 ay wala sot keme o keme tanning sab wora wala be ko type 3 ay wala soto abe Gambia nsafo ko type 1% damma wo research nyinge menke 1% damma wala ko type 1 kel bayri wo the more FGM nying the more itata type ol be selekan type ol to the more aka risk soto doctor ol ngamre bi janne be kuma follow wotol bari intolla Gambia membije jamal bije needing survival diamuta ibalo nala ko type 2 anin type 3 wala bije sukiro wo be siarin jeto sukiro wo ngamira almost ntol ning natata ko because Gambia mag invest in research puruka long tonya dantan ketale bari puruka ta deeper ka invest in infrastructure to ning research to puruka diamu survival ye ka understand monument ta bari nyimu sensitive fenneti mo jamal bije puruka finti fanka fu konte tata nyaka to le bukala fikaf because there is already a stigma attached to kafu konte tata nyaka to so ni tata nyaka to ikatara certain setting to le bukala fika fintindi mol kan konte tata nyaka to because of ibamera ko maybe ite buke ke satisfy bari fanan nini modol be siri ibe proud la kafu ko ntata nyaka to because imalla fi ya foyko imusolimat so you are kind of like ibe nyim two walls all lokono I'm a little bit deviating but ngamra important le pour nga express ntol as survival fanan katara nyim between walls all men kono at one point ikalafika associate with it and another point ibukalafika associate with it because of society KGB nyami but in tol ngalo and also nde ngamira control a lot of people from ntolo communities so mambalo faham bake because nte as a person I didn't even know nga type men sotono because mang female anatomy mang na reproductive system ma understand the normal tolka fo men ko normal musola private malo nunga be nu nyame malo nu memo inner lipsti malo memo outer lipsti ntenga mera ko nteng membente bala wala normal ta
okay
andu mbuka ko kacha ko men normal ta ni men man normal mbukalo so ni te mo moso to me alon ko ite man ye men bondi bala ite kabri dindin ne yoke ibe ke ba yakan moti je men be la musu yaji be la kafuko nyine bote bala ite be nyine normal ta ani nyine foni akaram bukol kon ite ka folo ko men be te bala is okay mo be wala ba bala bari ni nata yaji be inata wulu woto wala yakaran yenna talol jibe kalon nako ntata ni nyin dongo ta fatatale bari be ngalon ne koy be fatatale hanata da control ka men ko normally be fatatale bari même fana mang inner lips sotani outer lips ani même mang clitoris soto mfana ngawolon so men ka ke jeto type 2 bi jeto le type 3 bi je type 3 wo be janjandin jetol weda mol nga fo ma fo sukiro wo be siari Gambia
lafta kana ninje ndey comme Fatou ye nyimbe en foten mol la anatomy min defa ma jahal men kasi ka ko Gambia FGMTJ FC la biye wala circumcision la biye ka demandi na kuntuje wol mol kono men ko fo and most of the time ke wol la kanyin fo al simbalal bar men ko fo wol men ko fo jumale kono je wo ke wol inene musola anatomy jumale kono wo ke wol itata musola ndiya jube men tata men manta imalon fa what is normal ngalo ne kon la society kono sex and sexuality mol boko kara it's kind of like a taboo for nibe biology class wala tata university wala tata medical school wala curious that you are learning some other thing physiology anatomy and stuff yebuko ele yakara but general public jumale anatomy fango study ko musola anatomy nyina function to ya level correctly yalo mo jamato fonole so ni kasi ka fa mole ko FC le bije FGMTJ ko jakolo wartal ite wolo nyaadi number 1 ite mari malondo soto woto because idena mam muso landi ka wiste so men ka musol men kam ni musol problem o soto ta dal l'hôpital and come into la jambe nyamente ni for a certain age ikata gynecological exams like ika pap smear yeah understand so more doctor also jube for there's something wrong with you and stuff like that any variants bige is the advice mune be kalan things like the wale problem also but in toli buko ka mo kata le fa futu kona bina wululat wala wato mena le tantada fa kono da for certain fake koto iko be examination kai salon ko maybe this type ni bala ni type ni bala wala ni problem ta but na man to jumala kata doctor oya ika fa konta pap smear la wala gynecological exam ika kontibulol hanin be bi men to tay ko kontibulol la so mol kana mol nene ka fa mol ko FC la be Gambia FGM te Gambia nim me yo fa ni ka ite muna famu FC muna famu musola anatomy be nyaadi le ya ni ka ko sectional and men fa nan kanyim practice na nyin ngan simbal ngalen ko most of them man formal education soto there's nothing like a standard or set protocol ko okay musola anatomy bi de ne study nyanta nyine kongle ma nyana nyin kuntuna mol ngaji le doctor ka me nyamen karang la karam bungot ni mu surgery that's what is called standard of practice ni ata hanata incision and drainage IND drone nebe access yelela there are protocols for that ko ngani try different or work ta ma work for years back by evidence ye mol karandi wala mol ka continue ko ke pan to langa simbal fol ko kele ba moma mendi ate ka wala ke mello yo ka wala me yete train aka ka nyami defa nan ka ko nyaan do ya ko nyama
nañu ni garo so jang kadi la fa ñini garo ke la quickly tare yake bayri ñimmu kulete mi alon ko abe kerine andum comme modol be dol ka jela ko ila culture dol ka jela la tradition non dol ka jela ko dino lon jerñal siata ñing ko to bake fam so o kamala lafta pour yamma koy jang itala jerodo muneya tinna the civic education be kerinje e ka fam moliye modol ba fala tennom modol fa fala tennom bari modol fango bije wol fango ma bondi nyodo muneya tinna hansa practice jing abe caring and then abe continue kan fo akake nyo saboti famro mam futaje because alom famro e fanna jamale sodo pour ite ya fo jang type 1 type 2 3 and the grassroots level mini fango ka practice nyinke kibaro mam futa wala ko anyanda futale la nyamen abe kole ala le pour faire imam la fo
abe kole ala le because londoji number 1 comme mo le for tradition ko le dol ko tradition ne dol ba fa ko religion ne bara hanata ko religion ne mol ka hadithol men ko hadithol they are not authentic hadith you understand near Islam karang damandi fon kalo ne ko ni bir mol be school kamune fo sahih Muslim sahih Bukhari wala mo fen ko authentic hadith mel na do kata good hadith weak hadith you ka hadithol men na they are weak hadith you understand so when the mer fana mol ka continue ka ke because ka jibe kon temo misil moldi so malla to ku ke me ala no ko aninna islamo be comme ite titita mol sinamira ko ma islamo bunya ala men fon tata mawo bunya wala na mbe continue la kake waka mol silandi number 2 ka jubele ko mallafi nta mallafi do mol ka futu e ka ko mallafi ndungoyta bari katata community men kono je ika jiko sifa me itandila ike commandi tol men na mallafi ke tol foja ani la dimbayalo wakat ne la mol ye forcer ye dunyin ko kono ye fanke je kanata man die because of through society ye accept wala ne ka dun ko kono even ya lo mol bigele 40 ya la ko nyinka bata men ke mol fongol bije batata nyun ko wala bari dungol kamote kata because of what dol ka ke because ila futu fami tamo si doti nada futu manin ko liya
imamira hansaing faham role be dasaring wala tinna kol ka continue because yalla ni mol ya faham because be ku killing kalante I na experience yamande ngamira ko hanisa in the civic education ndela miro to maybe amam futa molla ko anyanta futa lela nyameng wala kibaro mini nyanda so tole maso ko mi nyam because ning mojamale doko ke then you know that was wato meta domande minni along e kanyinke bari ndela jero to komi hansaing komi ko e buka entolka fala e buka nyekere di molla so ni a nyekere di
ma comment quickly.
Do you want Alin Soba ngana domandin jeja ni Mustafa because Mustafa ka civic education no memfo gamko trap despite yemengo memfo they did a very good job kele FGM ita telephone ngari remember one time nata Gambia lifola yen samba fo I think it was inside Soma dropping of the knife musol ngansimbal yen knife obere be lota ya explain this thing ndengabra menketa backlash lekake just like Norway ikatale ya foko okay moli ñu understand ya fahamle sa inta telephone lu adunta sa indo ko bantale ye relax then backlash o yena dole na drong tung comme imam fatia wulindi nyame ndingam ra wole be kere bari education no wax dek ya kele and just quickly kadiye memfo nde bama musuru waleti afututa mandin kol kono and because of that yentol saba and nani na dad memo mandin ka dingoti ama support but mbama insistale because ika memfaye surwa musolem ay surwa musole ndefon kata feyala melif ni wotumo ndindi mambe lif ni Lancaster ngam vidile ni kata feyala ikante je surwa dindi ngoleti malon ko fon defa mamu mandi ko ika fonye ko sika ko mandi solimala ngatara kelo la je ni ka kele I still remember
okay mama
so these are some of these education has been done but backlash like it and relax tale ko okay cool baby kanyandine luwa bi jele everything is okay then pam hani jamfango is the same backlash
precisely yeah precisely
bari
precisely okay mama yo
jandi bita bamba ya Mustafa
bari yalo
jandi bita bamba ya ni reason ni
doctor doctor we'll come to you doctor for the doctor's perspective we'll come to that shortly please bear with us doctor
musola alla programme mo la munyente bar nal mal la fi ngadia mun tol si jino la damal tare because al damal ta be fono la nal pal damal ba fola then there would be no debate
Bamba diam zang okay go ahead Bamba
well nte actually ngan nambari musol tento back ya long kotubabul fawle men for experience is the best teacher but obviously nte nga mira musol be they are missing the point ning allafta pour ka molu karandi nyakala karola type 1 type 2 menka ke Gambia of course you people are right sukiroka ke Gambia I agree ndenga wol jele yo bari a deep rooted culture or religious practice like this because nimmen ko dina kunte you are mistaken obviously abe hadisol to le nal ko hadisol ma authentic hadis jamale bije ndenga research kenyum ko la bakele anunga research le nga faham ko nyin keta janne muslime amina nyin keta janne anabla esa fon be wulula nyin datita around the Nile Valley le kata through the Mediterranean kadunang Egypt la aning coast men keta Sudanti ni ajube fon bankol men fon ka practice ni ajube majority be Africa will be I agree with it but dino la karola obviously tonya kila ma bay wo hadis jamale be kering I make a constant research on this mbulata ko no malaka ko nyin jube ngaje ko tonya makruh lamu me ya lon ko kitan arabul ka kuma ni nyame it's permissible but not in the way ntolamul ka ke nyame
Bamba, bari kitan, bari what do you to clarify? Because kitan,
Fatu, hold on a minute.
A woman circumcision of male, what near Arabic interpretation.
Fatu, hold on.
Female circumcision on you, what book of for a kitan?
Fatu, hold on a minute. I am coming. In the hadith, we are talking about female circumcision. Female circumcision.
So, hadith Jumalem, you need to be precise. Therefore, hadith Karilem, so that we can go and verify.
Yeah, mbe hadiso itandila fatu puru ya jube, ifon ya jube, kaje ko female circumcision is actually permitted in Islam. Nga hadiso ultajanne puru for this debate. Sunnah Abu Dawud, Allah chapter 41 verse 5251, Abu Musa al-Ansari reported that there cropped up a difference of opinion between a group of Muhajir, those are the immigrants from Mecca, and the Ansari, those are the group in Medina itself, the Ansar. And the point of dispute was, the Ansar said that bath, that is ghusl, washing janaba, should be done after intercourse. It becomes obligatory only when semen pours out of ejaculation. Ako puruka janaboku abe obligatory lalening manio bota kewala. While the Ansari, those who live in Medina, said ghusl because of sexual intercourse becomes obligatory only when semen pours out. But the Muhajirs, those who came from Mecca, said when man has sexual intercourse with a woman, a bath becomes obligatory no matter whether there is semen emission or ejaculation. Eko ninkeo muso fututa woto awajibi yatale puri janaboku hanna yatara manio mambola. Abu Musa al-Ansari said, well, to satisfy my curiosity, I got up and went to Aisha, the mother of the faithful. Muli tantata na Aisha na Aisha me alon ko atele mu musolube bamati nga kumandenkai ko, oh mother of the faithful. I want to ask you about a matter which I feel shy to ask. Lafte nyininka la fenela maluta purke nyininka menna. She replied, don't feel shy asking me about a thing which you can ask your mother. Kana malu kante nyininka fenna iseba ma nyininka no menna, because I know your mother gave birth to you, but I also gave birth to you in faith. Ibama le wulu oto barinta fanange wulu dino tole.
Okay, Bamba.
No, let me bring this hadith. The hadith.
Okay. Bamba, I summarize the essence of the hadith.
Bamba, tenga question kili nesoto ni pareta. Nbenyi ninkawo.
Alinso. Another nyininka hadiso nyinjam fatale. Pare lafta pour ka summarize. Another nyininka kai ko wati jumalemu janaba kobe wajibiyala kewni musoma. Akai wati jumalemu janaba kobe wajibiyala kewni musoma. Akai ko when one sits amidst four parts of the woman, and when the two circumcised parts touch each other, that is kitanan, a bath becomes obligatory. Sahih Muslim, chapter 3, verse 684, confirms it. Ning dula fulolu menu kuntuta imata nyola, wotuma janaba kobe wajibi yale male. Aman jara fof manio botela waram fo manio mambola. Nyimu hadisoleti. Hadisi do fanambe jele me alonko Sahih Bukhari or hadiso fanambe jele
right.
It is encouraged,
okay,
not compulsory,
right,
on women.
Good, Bamba. Sai lafta minna my observation wala nyintiko me la filanga yankuba finanso because ya long traditional fole minnia experience minni fango ya balu wala ya fole sai bari yankuba ate is a medical surgeon and is a doctor.
Thank you very much, Mustafa.
So our perspective here.
Actually, I think medical fanko transcend follow, but Mrs. Baji, Fatumata, I point do for love to jere jibela fe. Ako research doke gabeno meaning where they confirmed, if I may be wrong, 17% was type 3. My research in time long, what date it was, a validity, where it was conducted, across which regions in the country, tribes, ethnics, or particular Ngasimba. Madam Fire research breakdown sort of.
So Gambia Bureau of Statistics nga data pool nying Walter 2019-2020. Among breakdown, I didn't go further to look at the breakdown of ethnicity nying and regions nying, but this was, if you look at the Gambia Bureau of Statistics ila website nyinto ila survey nying and research men conduct on FGM nyimbi 2019-2020.
I saw the article is published online. I think it's on the PubMed. This guy did it. He's the gynecologist. He's still in Gambia. Dr. Idoko, I forgot his first name. But all this data is there. You maybe if you are in certain libraries, you can get the whole article.
I have access to PubMed. PubMed,
correct, it's there. Just check on the Idoko and also on the BT. Because I think some of the researches, he partnered with Dr. BT. And their publications are recent.
So this was between 2019 and 2020, yeah, a year. And yeah, you told us that 12,000 people were recruited into the study.
Yeah, I think it's like
That's
the title was the article was.
women.
I think obstetric complications of FGM, something like that. If you
no, this is
search, you will see.
No, that's different. So the one with BITE, we studied in 2010. That's also contained there. So this is Gambia Bureau of Statistics. Wali menke womu 12,000 women le interactor. The one with BITE is 1,569 people, and that's in 2010. That's what that survey said. But ngamina publication or just recently lemwoketa. So it's two. So the one with BITE talks about all the complications, the impact menkake wale bije, and that's well documented. And we are for 4 hospital or tata mentor wale Brikama Hospital ti Jame Foundation Bansang aning RVTH ngamreka wala for. So that's separate from the one I'm referring to that talks about the types of FGM menkake Gambia.
Okay, so prospective study per se, it was not something they went through records or words of mouth interview or.
So the BITE one is observation. So observation, they went through labor processing. They were looking at postpartum the bleeding, homophage, is that what you call it? Measure. So they were looking at stuff, different elements, come C-sectional, post perineal TSO, many bekake. So what
bleeding,
observation? It's not like word of mouth. It's medical doctors that are looking at.
I think now looking back, even myself, my own personal experience being in Mogambian, because I worked there 2 years after my qualification. When I did a short 6-month rotation in gynecology, I can vividly remember a young lady from Pirang or Faraba. She presented with what I thought at the time was a gynecotracia. Gynecotracia is kind of stenosis or stenosis or tightness of the canal. So this young lady, I'm a Wulu. So after a lot of persuasion, obviously Gambia, you can understand, theater cesarean. It raised a little bit of concern and worries because our husband moved from to Taliban, husband. So we had to try and convince her, putting her some cesarean section. It was our first delivery mode, So looking back, I knew clearly more likely our complication might be related to circumcision. Saying, thinking back, more likely, I look at type 3 because when I read the whole thing, I thought now that lady might have been one of the victims. But clearly, that's why I'm here. Which one is the commonest in the country? Because you can give us the complications pertaining to what obtains at home. Can generalize is a little bit boring, I think.
Yeah,
So
but even I want to comment. Even type 2, people can have complications with type 2. Sometimes people scar. They form like
even the symbolic nicking. Any invasive procedure, even taking a needle and injecting someone, is fraught with complications depending on what the person's makeup is. Imagine somebody he has hemophilia. Hemophilia is a blood condition. When they start bleeding, they don't stop. And a simple hypodermic syringe needle that I am is a bleed to death. So any invasive procedure complication also, depending on the person,
Bleeding, I have an experience with that because I'm not, gonna disclose location or stuff like that. But in the neighborhood, I needs the dingo. I only not put samba FGM. I think the child was possibly 6-7 years old. They didn't want in samba. She started bleeding. Bleeding, you must stop. No, Dinero was pale. I remember this because I was in junior high school. They came to me, they asked for my mom. So I directed them. So one at a hospital call, health center you call. I tried staff in Bijaye. You didn't know you evacuate Yastambaje. Your blood donation there didn't know was in the hospital for at least maybe 2-3 days. Your blood transfusion didn't want to nurse work on again. But that child could have died from this bleeding, Yeah, so can happen. And sometimes even with labor and delivery, people who have type 2, they form bad scars. So near scars, so when they go into labor, sometimes because of the elasticity, they lose that elasticity because stretching. So those scars, they can tear open.
Yeah.
So because of the way the scar tissues are, even to stitch those is a problem.
Yeah. And do ya jela ko nga do woto kadi wo scar tissue nyu wala kana muta ay instead of ite cutting soto do mala ila perineum limbala ite kana cut soto ye dundinu nyaka to dama katela ko double operation cycle wala soto
kabi ye people develop fistula because fistula can develop through that because what connection it connects to other openings. Sometimes akata ila kama to dulala and wala ka think it. So imari ka discharge to order to many alam ko very bad order.
Very sign vendo doctor ya ma famala sign aka kenya me anim mineka ke.
Yeah, na sister fendo me for about fistula and gynecological fistulas. Most of the etiology, I don't think you want to tie it to female genital mutilation. They are poorly managed labor, what I call So most of the time,
problem also
we cannot jump at that conclusion. Labor that is badly managed, what like a gynecological fistula, so psycho-vaginal and psycho GI, lower
I can jump in quickly and add my ABC.
Sometimes a baby dies and the old woman cries. You will say the woman is a witch. But we cannot assign all of those ones to FGM.
No, we are not saying that all those cases are entirely FGM, but FGM can contribute to that. Because you lose that elasticity, you form those scars.
Exactly.
And then you tear up and they have to stitch you. So now you are conducting a surgical procedure on that person. Because the labor is complicated because of what? The reason is because of FGM. Well, reason only.
And Kadi, just
so you will link it back to that.
If I can come in here quickly.
Research, because we're talking about research, Dr. Nyinga research the results for you. Like they said, out of the 1,569 participants, right? 23% wale had no FGM and 77% had FGM, right? But they said the risk of postpartum hemorrhage was doubled for the women with type 1 FGM tripled in type 2 FGM and increased by 5-fold in type 3 FGM. So eco C-section, perineal tears, and in for neonatal resurrection and in prenatal deaths, wala risk is more increased. Wala come nindinunga wuluta ya resurrect, wala nibe wuluka ye TL soto, wala ye operate is increased by because of itata nyameng nyakato. And du nyinketa Gambia la make ko tubabo le kadi mola Gambia nyinketa study nyinketa wolto. So ngamwele the person nying member of parliament me nyinko sambaba foka neko ntolte fem fintindi no la te kaita ndiko Gambia kono kisi role keta jele ko menu tata nyakata ka nying impact le dila mba foka ngai ko ate ita kisi role ke demanding because ntol ngan research kele ye nyinu mol many beji be ko musol men tata nyakato they are more likely to be operated. And the new research it's not even more likely. It only higher risk sort of you will operate, will ning tia sol sort of nibe wulula ye baramol sort of wala wuludula fara wala ni wulutay dingo ya resurrect come ya ke come fatal no ya wulindi something like that. I don't know how to say that in Mandinka, but research sort of tell me
resuscitation, yeah. And clearly,
Nte C-section neke birin kan dingo so nga C-section neke because of FGM. So nyimman ke wuli akut. Aliente menje tirinja nga C-section neke because nte wulu no lan fight. Because this FGM
I want to talk on two aspects here. Bugana was a historical perspective be relating it to religious aspect personal experiences. Because I believe most of us talk about FGM based on our concept and belief and relations to it. So I don't believe in the first place is a religious thing. Like it started because of religion. Religion incorporated it. I want to believe it is a traditional practice that has been in existence before, the advent of religion. And when religion came in, it incorporated it into it. And then modern scholars think is because of it came about because of religion. So Lolo is a fallacy, one. Two, experience B is like the prophet, whatever he says, becomes sunnah, a practice for Muslims. Sometimes they ignore things. And when he does not mention or talk about it, so ninyi then they gis nehenna dahuko, why it's not something that he has openly kind of endorsed. For instance, I'm not dom jigen, I'm not sit yugur because domam yugur yeb dan tela de. So he did mention about setami ne harafal nalen, but there is nowhere scholar bo hamne munna quote and state categorically prophet wahna ne harafal na domam jigeni. He didn't talk about it. So Lulu, by virtue of that, one can say ne mom he did not encourage it, discourage you. So it's a traditional practice. So feel nane Lulu is not something that he can talk about. So for me, because of his silence, it's not essential. Ninyi war nañ ko practice. Two, experience jigen yo hamne dem nañ lil ak ñu demul lil daf day ute. When it comes to childbirth, when it comes to other experiences. Because for instance, henna man, if I am a female bee, suma ligé henna suñ ma harafale hamga ñung ma nota is like because of the concept dañ feel ne suñ la harafale henna notuñ la dinga dem foy dinga ya hasandaw. So you sometimes it's like it's really, really difficult because in our traditions, like ñun soy jël sa jabar neka jaha hamga family bi public bi yepay gada, and everybody would be expecting ne henna nga jël ndaw bi ñu gel gis malan bi henna mu yuhu fale, and sometimes you find those really, really experience very excruciating because before nga muna duga si jigen bi yo góor bi sa danga struggle hamga dinga am lacerations and all those things before ñu ñëw dogaat jigen bi nga wara ñëw dugaat si mom dafa melni is like double pain. So lolu I don't think religion would subject any individual into such painful experiences. So
Mustafa, I want to jump in here. I want to just shift a little bit. So lafta kata kaben kaba kampoto men ko kami religion ne okay sai min sonta okay iko sunnole itol ya fa nyame ko FC la wala en circumcision ne kada mandine kuntuje bal ngalon ko nyin statistics sol men kana majority of namusol amanke ko kada mandine kuntuje number 1 right and islamo te multala ke ham fanara sungo men musungo ko mol ngasu melan ko sungo important, right? It's a third pillar, important. So sai ni be kurandi ala ko ikanaso. Ani be tamale bita distant jamfaringoto ala ko ikanaso. I optional dila me ala ko you can bypass wosungo because of ila conditional. Okay? Ni hani salome important ni mental health soto. Mental health problem soto. Saloma waji bi ya kampuresa. Ite kitini la wala. Yeah, understand because ila mental health that they were impaired at that time. So sai nin ko hanata sunnola nyinti ya fanya me majority mbe alon ko abuka ka wonya andu akaten itol kanya wo menke molla wo kamol batanda kamol tora famol ka faje sa islamo bo kondon la nyaati woto hanata memmo ke ngamre islamo fana be excuse dila na munen ne maki
okay right yalon
kadi mbato mbala li Mustafa mbato ko
la observation wolom la kurun na kuma kan ngambalu ni minna jang
Mustafa mbala li ngaw bambandi domanding islamo fa may mem for ham to bang baydi islamo le ko ning fengo me alon ko is permissible in islam bala hamle siata ala benefit that thing becomes haram ngamira ngab ngolto to janne men ye dino karam fanan tol fanan katale nga kisikisroki islamo le ofo konin fengo mu is permissible hanata ko sign sunnola ate dina kilingolo ko nyoko nin nyin kode ala hamle siata la benefit alko tujele wokko bukake kotenki and also dina kilingolo fana yafo ko ala yen tol da nyaming as hada madingo we are perfect the way we are comme ala la dada ay fengo mende da ite na yo bonda be nyaming wo fengo manyang wo fengo mu sinlet that's not acceptable in Islam. So ninga dino samanang wo dino fana wo perspective ninga wo fana samanang kachakon.
But what was going to complicate the fact that males are born with a foreskin, and Quran says al-hadith or Quran you should circumcise them. Circumcision is excision of the foreskin.
Haniko circumcision, haniko
male circumcision. Male circumcision.
But ibuka bebondi doctor. Ibuka bebondi.
If we should compare it,
I'm just citing.
Abekela ko yeke wote wolem organti lika membondi tol bala womo organ leta I function leta to puru pleasure ala I wode dan tol yende don puru nidia ke wota ka membondi aka nole mabo ke wokono aman sene adino ya safale categorically clear there is no confusion around male circumcision and the wo comparison ning e ka menke wole batina lako mol ba kondon la because FGM is completely different from male circumcision no me alon ko excess skin lem ikalia bondi is clearly written nyindongo iko ngade dalien ne pour alien nidia soto nanal ke mal fututa sila wofulo libe compare no la nyadi
yo bari muzo fatu al hekatu domanden doctor ibe janne certain doctors sol fana ye benefit sol fole for people that go through FGM aitandiko musola nyakatuta jamaa ya foko dalili takan nafatije ako Dr. Hamid Al Gawabi, Somali gynecologist, I knew foko. The secretion of the labia minora accumulates in uncircumcised women and turn rancid, so they develop an unpleasant odor, which may lead to infection of the vagina or the utera. I have seen many cases of sickness caused by the lack of circumcision. Circumcision reduces excessive sensitivity of the clitoris, which may cause it to increase in size by 3 centimeters when aroused, which is very annoying to the husband, especially at the time of intercourse. So in my view, sometimes this is why in Koiko we are in uncharted territories, because we are dealing with a very sensitive issue here. Meya lonko ntolu mbama nyolu mama nyolu atol men mbeme ntol men be kadiam nyambama nyolu mama nyolu. They've gone through this. They did not have complications at the time.
You cannot say they don't have complications. You cannot say that.
You cannot substantiate that.
Alinso. Naliko sign complication ol kasotole. ntengamira the best option si menno wole muka kacha. What are those complications? Musoli menno kanyaka boyo ke ye karang. Because modol bije wolka ketale, they didn't go to any training, and ndol bije wolka be bondile, which is totally against Islam. Islamu mafuko inyanta musola Christians be kuntulale. Islamu mofo. Kila ya moro kemena wole ali domandim bondije. Katu nying nemu musola nidia blate anu nyina faranka kyo kontani. Nyina ba hadisoto. Me yalon kontenga menje. Okay, ntela argument momenti wala munyitiko. Mol menu kafuko, molu kafajele. Musomen kafa timoto wala siata musomen kafa nyakato.
That is stereotyping.
I just have 1 more minute.
Yeah, but that's stereotyping.
No, I just have 1 more minute.
Itening Suleiman akatara nyola kaka fonka singala mo asi awas buka femfono.
Habarim fanan sodoma nga 1 minute dronga nga I would land 1 minute. 1 minute, let me land. Nte yalonte nte tendingol sambala nyakato nte. Ngawo fole everywhere. Ya understand. Bari nta fono la fana menko alafta pour kake ka fay ko no ite manyana ke la luwale nyanta taraje menyante ite mari stop la. I am totally against that too, because woman is against those people's human right. It is their human right. For crying out loud, human right violator.
Thank you,
is their choice.
Bamba, okay,
that's my belief.
Bamba, then it's okay also to violate the right of the children, because what didn't fanang let me give you my example. I went to Gambia 2011 for holidays. Ndata mbinki majube. Ndata ya akafonyo ko ndingo 1-year-old daughter. Akafonyo ko tira tujang anin dindingo le nyolong. Ndefanang I was insisting ko yes, anya tara ya anin dindingo nga ko sijang ifanal nyin nyolong. I didn't know the agenda. Meye mako didn't balanta. Ako no because aman dalila uluta jana kuluta jang. So unga ako okay aman somba tu nga samba. 1 week after na horizon data jube kata kontom bigma. One of my favorite aunties. Ndata jenga sonko tara sokono. Mbafala na kotine wo na be sonka lanka ako no. Ini na antite diam la teng. Ako nyoko bari malo muneketa. Aka endi ngol leta e samba nyakato. Resista wala. Nga ko je how can you do that? Akonyo ko niaje ngafo yetira natinye ani ndini ngol nyo ndafta fana sambala nyola hani bi nimbe wo folanka jijale I shake
that one is wrong.
No, because niluati je they take your child with or without your consent.
That
and
is
I
wrong.
Okay.
And
that is the abuse.
In that sense, I'm totally against that.
Bamba, no, because those kids, they don't have demand from Mbama and Samba. Mfama didn't want it. Mbama and Sambale because of Mandinko, Abe Fututa Mandinko Konole, if I feel like you don't want Musolimality, and that is what was the problem. And they had to take me out of my father's rejection, even being a Mandinka Dingo. And my father didn't have to go anywhere to understand what Nyaka, but didn't want to put out his children through that pain. So these are some of these problems. So Nilua begin to come Natara 18-year-old diningol, ika wole taye samba nyakato. Wara 1890 so iko yes, I will go. No problem. Ninja ko 18 for the 1819 left tala nyakato, no problem. But diningol melialong I have no choice. I didn't ask for it. I have to go through the pain. I went into labor. And then that's when I realized, struggling, that's when they realized that it was FGM. Most people even don't know sometimes. They forget even it has any implication. This complication, you realize what are these issues. Let's allow people, let's remove things. Let's not skip. Every Christmas, my father makes sure that ngatara nyamina kudang every Christmas. Anything that is wrong, musol koku is wrong when it comes to a musol affect. It has to happen. Let's stop that. The problem to be kata trumena is it has problems. Yes,
They, you know me to be a very great advocate.
Okay, right. Then, no observations to the I want to. Can I come in here,
in this particular instance? In this particular instance, I tend to disagree with people trying to say that there are health complications. There is health complication in even eating food, and obviously there are also cons of not going for FGM, because sometimes circumcision prevents stimulation of the clitoris, which makes it grow large in a manner that causes pain.
Mustafa,
So,
I have to come.
You want to call it a clitoris
I have to come in.
Exactly, Papa.
What
okay,
Bamba,
just
what is important? Nte sonna men na wala nyinti ko nying FGM ko narrative all nying alimbalal dorong bari mus kewal na e bori. Like I've just told you my experience. Ita fo no la nyeko, ita man lante nga memfo. What was saying? What is that? Ntele nga balu. The best expert is the person who lives it.
But
this whole conversation is going back to patriarchy.
So
musola nidia anyanta limitless sotola kewal ya feel le koy ton nyanta control la musola nidia nyanta imaje bemba ka foko clitoris ka jeke like ay wara wonyama iti lafta ka folo ko medu tata nyaka to medu wanta what is theater Nimme ya foten ni ajibe kewale mamanke musuti.
No. These are women that
Bamba, research.
Can I come in for just 1 second? Can I come in for just 1 second?
It's getting interesting, which is good. I like that side. I like the interesting side of it. So let's make it interactive. Yes, come in.
Okay, because Mr. Baba's yellow point note. Even in the UK, St. Mary's Hospital, one of the most prestigious hospitals in the country, Paddington, one of the co-founders, Dr. Baker.
Yes.
In between 1958 and 1960 something, I cannot remember of it. He was offering a lot of operations, reducing the size of clitoris. They call it reduction of the clitoral hood. And the hand side, Tibawol ka practice kele, no? The Tibawol they do vaginoplasty, clitoral hood reduction, and even labia refashion. Hand side Tibawol ka kele. But yala obviously. There are people who want to have it and they can consent and they go and have it.
Correct.
Yes.
That is one thing. But if you come to circumcision, they are not consenting. How about an adult consented? I want to have it done. In that case, what stops them?
Doctor, not adult that wants to do. The problem is that circumcision is done to young people, kids. That's what is happening. It's kids.
I know that's what I highlighted first.
Yes.
So, what about an adult who is a black person in Gambia in our context? He voluntarily turns up and say, I want to have circumcision done in a country where you're outlawed. What will happen?
No, but it's illegal.
Janinka putawoto. Bamba kamen potenko ha momo kami ni mendle pe dungo samba ni mama lapi dungo samba. Bamba ikanyina lako ntol membe western country ja. Nteni nkema dingo muntol dingol. I mama I binkinyol ita kukala malafi menke because alan ko wala bija. You understand? So Gambia ni mo futu dingo soto. Wadingo manke ko iteni wo mari drone dingo wat. Mobile dingo wat. O musola family dingo la wat. O kewala family dingo la wat. Nebo la family dingo. Ko ka nebo le fangol je tela ila nebo dingo ka ya samba nyaka. Wala na luwal be kerinje pour kamol protect.
Okay, yako bunya na maninkari. Lafta min fola jang, wolo nyinti ko yalong dobi je ko ndela jero lo nyindi dobi je ko min ketano gunjur ada kala no sabeji katum gunjur la ko mada sabeji gunjur la ko be sabeji nyaato bakele so nin kol be laare go nyama e kamin jibe dobi je mandinkolia surwalia fulolia jolalia aning yalo nying setup fanam bijele so nying e kanyunu be put la into consideration coming sekeno Angleterre or England fo as a keno Gambia na ba kela no Gambia mamu approach si fale tala prungaje ko ay keno kon lafta la nyameng because yalon to la mol jama ku kilen bije ni lafta fola moye ko nying abula maybe ba fola la ko nyin do muta wala aka keten ni kay ko kana ke iba fola maybe aka keten ning ten wosi fal coming malom fo wo because han say neaji be molla fahamro aka mulne ko abe dasarinde mol ba falako dol ba falako dinolo dol ba falako nyimun dola traditional na culture te nta bulala nta kala ten ani wasifal han say abe caring han say mol be nyo sabala han say kuman bonoje kuman kenoje yamira you don't think mba fenne so tokan wrong jambang mandara fenne ke kan right ba ndey ha
can I come in? Okay.
Yeah,
Dr. Gon.
Yeah, Doctor.
Human behavior for Nabanyami. Nil after human being stop la femina. Protestation or car follow. We can go back in history. India, they had this tradition coming for sati. Sati is when a husband dies, Indian obviously don't get a more janile. So the funeral pyre, musoka fong for the mark and I with it. So you lose your husband, you have to die that day because Neo Malay be from Filo di Bacono. Community Bible Tataje, obviously Tiwawale India ruled for a long time. They wanted to stop the practice. But because the Indians felt that at the time it was an external force, they went into this thing, they started fighting, and people are doing it. And up to today, people are doing it. There are some things, let me say they are unenforceable, because enforced now. Kenya passed through the same thing. Kenya independence movement. I'm sure a lot of people do this history. I think it all started with this circumcision, no circumcision, the Kikuyu movements. They started rebelling because Tibaboli appointed Yelko circumcision bulalale. So the people started revolting and did so many different things. They went to the extent teenage girls or the man can circumcise. So that is what will happen if Imam Mul currently ni ma long follow. You should teach people very well. People know what they're doing, and they will pick their choices as per what they want. Unfortunately, in this, we are saying the victims are people who cannot take consent. But it is a ward or a parent take consent on behalf of a child. So that is a very difficult issue here. And Tambila no jailer. And say argue be for soma. Moment that no jailer. So I think we just go over that, teaching parents as for what their choices are and what they want to do with themselves, their wards or their children, whatever more market. This is not to say all parents will say yes or all parents will say no. It depends on what you know or what you value. So I think we're a long way away. Looking at the reaction from even our team members here.
Yes, thank you, Doctor. What I want to say is that Mustafa, you were talking about Mustafa, we talk about corruption in this platform. When we talk about corruption, we all know it's bad. And tolko luaye taraje pura corruption o tala. Bari moma foko nyanta jubel membe gunjur, nyanta jubel nyami na kudang, nyanta jubel membe banjul. We don't say that in this platform when we talk about that. So why is it that anything to do with women, we will bring tribe, we will bring sectionality, we will bring elitism, we will bring division of karanale mankang. Ndolko nte jobate. I went through it. I said my experience is bad. The whole thing is bad. I also say that I wanted law to protect me and my children because I don't want my kids to do it. I go to Gambia. If my daughter didn't reject going to my aunt's house, She today would have been statistics as well. Part of that. I want a law. Everything. Mang balanka foko Dr. Kamem foko mol karang. Yes. But I would like to see a law protecting people who don't want it. Let it be there, the law be there, and then we continue the education. Momo ye 18 years soto. Musukanango. Itata iko ila takela. Fine and well. Do it.
Correct.
Okay, Ndeye, thank you. Lafta min fola jang. Okay, lafta min fenkela. Okay.
Mustafa Mbala nga fer la fa jeto because Dr. Memfo is important comme karango is awareness raising and ngamre wala nambijang and a lot of grassroots work fananketal. Bari karango fanang ning luale katanyola kabri lua nata aning science we all see it hanata ko research manke and research ketale to establish the 2% reduction ketale in FGM rate ni ikafaham so lua ni for people just to hear that ko lualem aka modol ditale ntol be bota Africa le ngalo ne lua be nyame wotumo ika jubilate nyame outside when nyama ka celebrate it's no longer happening in Gambia. More beka behind closed doors, many baki behind closed doors. So, but it's true. Awareness raising, education, and in Lua they go side by side.
Yeah.
But also, let's also talk about culture because it is Mustafa Menfo. It's like you're bringing cultural relativism and the universality of human rights. Sign bitakan academia because you're saying not that you know culture and yinti. It is a phone or like being bondila na West Yasaman and Tolia. Gambia kon. So culture, we cannot use culture.
Maybe man farm ko yalon dobije akake in England nyameng ni nara purka explain gunjurun ko o Gambian ko maybe step sinya simfala nyande taraje mi ala ba fala pour wolia understand no ko ala nafa mu nyinedi aning ala toro mu nyinedi pour ya understand no nyama comme akake no nyameng in England ni nara ko ba fala module ko exactly akakenya in England iba fola module wala nyama abe koleala le puriata because kulo mi alonko ike bayata kan ko nyim fananka ke baya ite kanne so comme nina da pour wo mo sifal ke fahamni ita fola no ko akake in England nyame iba kala wala nyama wala akake in gunjur nyame ba kala wala nyama ni da basse mulla kul fali mang mulung nina da wo fanna lan ka jela
exactly and then wala tinna kabri FGM to diala inata slasi kije cutting kije to because in some cultures more blush about the FGM because ya feel like ibe culture so attack like iba ke kan control mamol men they do it out of malice so people are self-conscious about those things even the language that we use nintata Gambia be nitol they prefer cutting la use la but that doesn't mean that those types don't wobuka ke Gambia akake jetol lafte ke murundina because mol ba fol kan ne ko nyimuntol la adult bari ada jelu Mustafa ntol nga wala tu Gambia me alon ko mboka ke sign ite ka mo jelle je me alon ko ike jang timo jang the here ikata
so katimoso
they don't do it anymore sondiro yente bitile manke mandin koti bari mbama mandin koti mandin ka ado yo wala kentala sondiro ya kentala le sondiro do you hear it now akakili bara mansia abetala kanni and then because culture mo fenneti me alonko is deeply rooted it is entrenched nte wuli no la make ko we are getting something wrong there it's just naturally difficult pour que perception or change so wala tinanga education samana wala tinanga loi samana pour ibeta side by side pour nyin ko ebo bari lefta ka murun nang because ngala nambina talale bamba e fendole for about nying clitoris nyinga murunga kang because concept nying ke wonni wala be bori kang comme kewo muso ni manta nyakato ila nyindulato jeka extend la ko kewo taka dan nyamen e kan nganya role lesoto anin nying dunia kono muso men manta nyakato wala siata muso men tata nyakato
correct
across the board ato lafta ka fonyalo ko wo muso dunia muso be itol yen nyim problem wala soto so niaji ba ako puru sensitivity nyim fana yetala so yaje le de yeke wala mindset jele ke wala lafta te dia enjoy fa danta dame bari nana ta musola dia la enjoyment wala hani ko atol nyanta 1% la soto wala atol nyanta 2% la soto isaje ko alkana ta tinya nyanta kan na dindingol karandi men na wala ka muso kala fim ke wala among depend on foye wodula soto le foye masota among depend jetol a depend the mindset lella a depend nin ke wonyinella a depend environment lella a depend te fang understand nyame ase muso ntata nyaka tole ntela problem o nyaka to ta moment wala wuluwoti amanke nin ke wala kafo womanke na problem ot so no jeso to I clear we cannot say because you've gone through FGM ite malafi ke wala ntela afta ke wala nte lafta ke wala andunte tatak nyakatole. So you cannot say that ko musol menemanta wala media nying is so heightened. Yes, ikatalale but niye fango balo understand. Ifango ye fango balo understand. Ila kewa ye balo understand. Ibe the right mindset to is a futu onye isa enjoy no andu moma right to ka model of quarter media ta ka kot because alale wasn't so wala. Ako muso ninkewa be ni kafuta. Ke money alon koy fututa it will be nyanta media sotolal so jumalem atolti même kewati ka lo ka foko ibiday mun kemati wala mun barinati wala mun fati ka foko hani f itela ni kema ka foto ila media nyanta dan na janne ali nga wajibe bang it goes back to the control, it goes back to patriarchy and do walem na problem what in society.
Fatu lafte nyini kala le bari yalo ifango kumo bane ko nyaka to tabu kamo bali futu media sotola ite tatale bari ka futu ni dia sotol
wala mtala experience te
exactly thank you very much alonte mbar musole malte andale nyin kacha kole ande mbulu baki because this is the first time tene musol man tara kokele musol dolu men be advocacy la for this and I have very good reasons na dalilol momenti wala mu malla fi moye mo forcer ka samba malla fi moye kuntu mo fana nyato men laftata. That is my point. Amanke ko nka FGM le support or nka FGM le against. Nte nga feel ko nyimu deep rooted culture te me alon ko karandiro le nyanta kelala. In my view, ninga be bola avi demanding karandi dan nga ke luati nga criminalize because nim modolu lafta kala comme Mustafa me nyini ka waran doctor me nyini ka men yalon ko they are 18 imari nyon lafta tala silang nin loi ya criminalize. How would you regulate la nyadil?
Baba ito ka mo jumale je membe 18 menka wuli voluntarily atra ko ma pressure society ma pressure watra ko ma ko was awula fa ya kata dunya ka what a pressure la
angal ter jang nyimbang kun kan jang angal ter Birmingham be jam
but that would be for
no but let me finish Fatu I just want to give examples. This woman was going through labor and she appealed Puriyanyaka. I have seen that here. Mantara femfo kamea lon konta base no la fenka. Nte mu mole ti mea lon konte ko andu lafta molbe en kota lon konte di musol. Nte nga menulu. Men yalo koy fama mu bamba masleti. Nte manta wol sambala mote sambala. Ni lafta tala, that's their choice. And I'll make that known to them. But nte personally manta ke samba. Nyinka malako I just as a human rights activist malafika mola human rights violation nintate samba inata meng imalafala then I will be wrong to them. I love my children so much malafike hot but also now for manyana tina ko nin dudu nkotoma ati lafta purka dingol samba ntanyanta fulane no inyante batla for 18 soto that he is a full grown up man atella responsibility mu ala responsibility diatella prawo dinulu kulu daji kola ay londi silatili ngokam ala ya mari wol so andunte ma understand no nalko the girl child nka molla human right violation because ikatale dindim mal come on for crying out loud ndolla parents ol kantol tola len dindim ma e ka modo tola todola wulu kono like comme misal fe ni ko suntukung nga denano todum atomu suntukunna ay meng amal la fi suntukunna for imala human right violate ba
bari what is reversible
Bamba yale ka kenne kompe ameni yala ko manyen ko kompe
apple and orange same mix
it's not reversible
gaji bar muso le ko kole
Bamba
Bamba ini Suleiman alko wele kente la jandim bijang so
Tata lata kusirin kala Bamba
Bamba because Bamba akamuta ko ite coming for Bamba let's go back to corruption tolbeka I told Mustafa we go back to corruption so ite kala fi même fola ko manya na loi ke la corruption na corruption tuje ay taraje momo diata ya man sakundala ko do beta ya samba na buli o nge bulaje for momo ni pare do yeta ya sunyaro ke abanta ani okay why do we have laws we have laws to protect people's right so
okay saying
Mustafa lafta fenne fola ni dulante important Bamba nyanta understand nako ni luwa be kala luwa ika majority le gibe majority interest animal be protect la nyame ko wala jibe luwa bu kana mena ko mo be do 100%.
I agree.
O mo clean. So fulanja for left men for mol kanyin sex drive men for time dol ka fa libido mol nyanta understand nako clitoris amanke ko walen sol fen ko libido pour muso kewol ni musol be mol balo ala yede dal hormones bijele neurotransmitters bijele ikadomorol men de ma bijele ila environment bijele. Yeah, understand. Ila upbringing, all those factors contribute to a sexual drive. More me alon koko ya kulu in a more religious setting. Ila near studies jibe, ila libido drive is little bit lower because ye karandi la religious school mena about sex. Model bije ika problem osre la hormones. Ika je fa hanim beke bayan. Muna nela sex drive katala wado ni beke bayan. Because your hormones change.
Great. Okay.
So because more in Kanye Facebook cover ko ha kadi to in Kanye FGM mempo nimma musol samba nin dinu to concentrate la study ka bet loud bet la ke wol no bet la ke wol no mentality.
Okay. Sign maminkela. Ha kadi maminkela sign left them in because mang imam Surono for some reason I've been trying ada fana mbo gunjur janna at the moment do be connection okay problem he's struggling akawa bitala station or ajibe fawa bendela no because lafta model because bring a wulita maybe a wulita ning dino model ka bambuning dino la komala model e bambuning traditional komala model e bambuning lua komala so nyim bambu sabol be lafta ngolje dole bambuning jata kende ala but luckily nga most of the jamia lon ko jata kende ala fanna atebe fem fola nyewotule wol nanko minga dino minika bambunin dino la fanna ngo soto jang although serigne atamu serigne la di bari serigne debe ake serigne faluti debe ake serigne bambati ala cool mo bu ka fam do yaye ma bari lafta sol dafa daw sol bu ka hani baake ni sonko candidat ka bolle Suleiman
Sol has said his position very clear. He made his position very clear.
Okay, but sai lafta minna
they be okay be bari ko fasa kana mam position tajam.
No, but he took a position. Yeah, he took a very clear position.
What position?
He's against it. He doesn't believe it's religious.
Sol Bortale among he's not against it.
Okay, lafta min fola jan sai bayri sai nga moso de mi alonko ate bota fanna dola mi alonko wolon jata kendeade abakumala bake ate fanan na jero to nyindo fo nyim practice a better atale for amam better five health complications role na soto type jamale ya soto anin ikamin befo because malla fi koyeke ayke kachati mi ala wakela equality bari ako ayke wote iko do biye woka falinde bari ako woka straight le jama because abota kuti o fongole da kono so lafta minna doctor emma ko jam fanna sabo o flow min bekere emma ko woto jata kendala karola Dr. Yangs
at physical health problems let's go to the physical health problems. Okay, so thank you. Female circumcision, to be honest with you, among mutilation ma endorse it's inappropriate can use for anybody. Mutilation, if you look at the English definition, is to destroy something beyond use or repair. So I think it's very derogatory. It shouldn't be used. I do not think it should be used. And then that are physical health problems also. Obviously, if you look at WHO's definition of health, they said health is not just the absence of disease or infirmity. It's the complete social, physical, and mental well-being. And it's always a confusion to describe is cutting that is not therapeutic. That means among physical jararoka marila yemin circumcise. So come yakele, but it's not to improve wo marila health. But then wo is one small part of the jigsaw. Because mbe alano ka meta mul kono ni circumcision o meta keren. So say another nyadile in the first place. For me, not for a long time, I began more back kamul bondi water, amanta izila. So kawuli be India molo. It's just the beginning of it's just the starting of a very long journey. So Nintel Beba Siri Jamaica miracle is going to stop today. No, it's not going to stop today. Now for Nyami, as with anything, ni left a mall for sale, abakela the woman that I stop. And if you come up with a law, how do you enforce the law? It's one other thing. But you got a job movement debate to tell us the health complications. I'm very much happy to do that. So the health complications, because any surgical intervention, so complications will be blood loss, amariba blood loss land, because ya balol kunt. So model well they are born such that it will need a bleeding start, blood loss because stop. They will continue to bleed for a long time, even with the smallest intervention. And painful cancer. But more of an so the other reason more bleed labake depend on operation C farming car. So circumcision coming part so is a part 2 and in 3 types 2 and in 3. Well, they are very invasive. Well, kuja maleke mobile. Wo because not only ikala mo kuntu ikamin kunta kasiale. Because ikamin kunta siata landa ikake daming purka bleeding stop jeto akoleatale. Because nimbulko nibulo baramata. Tiwa bleeding stop nya the coming yellow boka mobile purka stop. Tiwa for elevation, positioning and elevation. Nifang misika santo ala blood ala yellow kalus nya makatalal. Then parking and pressure. Parking and pressure all munto ya dress ye pressure la je price stop. But imagine word la moba je pressure la nya dil. Ita pressure no la tariak. And in position for now because more CJ can probably stop je for now koleala. And in blood vessels so many last supply. The internal pudendal, they kind of, I would not say they are the continuation of your aorta, but they are pretty much close to that. So blood kabola katonyami katadin volatile purka pressure like akokolea. So the more from bleed tobacco sometimes they do what they call embolization. Embolization is very invasive. Ibitala tonkolta kateta yamari sambal lab by some imaging, very expensive procedure. Your arteries will embolize. Embolize means you think you put a bleeding you stop. So sometimes blood loss move fendo complication. The move early complications all that. And then obviously you more nama, your skin na compromise. Infection is something that could happen. And the infection depending on bug cell millimeter, depending on the type of bacteria, infection is a real risk of any procedure, type 1, 2, or 3. So the other complication, early one solo, coming harama do night demo soto, especially honey kebalte the hemorrhoid operation okay because it's around that bottom area. Because of demo, sometimes because you sooner person, they go into what we call urinary retention. Urinary retention is very painful. It's like the male equivalent of labor. It's very painful. So I could wolf break a cane because a procedure damn in my family. So some other complications, early one soul. Having an infection of a blood loss for a urinary retention for. It's a fender transmit no to your patient. Come you must need the same instrument used for many people, especially coming traditional one or community use, but they aren't community use. Need the same one we use. It's a HIV transmit no hepatitis B transmit no, and commonly from hepatitis C, always a transmit no. And then because a wound is involved, more immunized as a tetanus gel. Yes, so tetanus will be no complication or TGL. But these are the early complications. And then other long-term complications, not only yeminke awarata amanke type 1T, coming type 1 is limited in complication. Ikata dumanyami, coming badi afanyami, complications will kasiatete because he come in country come in namak siata. So complication will is all been for no wala nimo baramata rek pray heal. It is followed by scarring. Scarring manke primary tissue to secondary tissue long. Ala elasticity buka bete yako the original tissues. So if I tell where childbirth, labor, or even sex is involved, sometimes last scarring is a bit difficult because it's not as stretchable. So once again, complications will delay long term. Other long term complications. So complication will be different coming. Ye mommy is suki, for instance. Biri yasuk because sumuna ka fintin in damina abe dami sumuna ka fintin damina over clitoris koto domandindro ama jamfa clitoris la. So the procedure ke clitoris balani yalonko either by accident or by intent. I uterus ma. Ibina a problem with dilo marida na be sumuna. Sometimes from you can na be scala, na be heel kan, aka scar to the extent that amari pusumuna from itindaka koleal. So mosifa fanaka urinary retention sort of sometimes ka urine leak demanding, and they have personal hygiene problems, purila sumuna. So that lead to the more invasive ones, minika type 3, minika fenjama bodije. Niajibe ni will heal the sign. Minka tuje puru bat canal, ninka bat canal, de nano canal indamina, jika de tabakel, puru mario le wulu, ofanaka kolea, or fana blocono. A kolea bulle kendek because de nano la canal ni. It's like for me, I sometimes at a bulkonding from permit, and de nano to fintino new wall. So puru ni will see fa dol bita, namanke hospital environment where it's a cesarean train or tariake, what didn't see fa te fintino. Because canal in atale or scatale. So one more complication to all of the third type. And the one for now, because then I know me I'll be labor for 12 hours, 24 hours, because either in a traditional birth attendance or the I wouldn't console or kunjuru will see value local or the strategy. I could collect poor wound, you know, it I wouldn't know because they're not in annual, you know. So we'll see if they should have a quick gynecological obstetric assessment, pre-cesarean section arrangement, you will lose such babies. So complications, one of complications with fertility and complications with childbirth. Well, they are very common there. So need a bit of the sign is that to other things, meaning coming for gynecological fistulas. Because your operation of Minkeje, yake around the area minna, nyato da matije, komo fanabije. So sometimes operation on your knee back is a sphincter damage nole, or is a funkala layer sul from penetrate nole. So nyato nin komo from dobije, if you look a connection or sort. So if I go kamatotaka fintini nyato ta found will be worse kind of complications, well worse forms of complications. Bari wolu mala statistically. No read Gambia ko siata je, but Somalia will misi fale in practice. A siata will tole, no? Somalia, Eritrea, aning muntoto. Will the very invasive type. So intemala ma evidence of the ko type 3 siata Gambia masud. Ni research been for the majede because yalo research la ko koleatale. So momos will know the evidence of it. Need to have all the weight of evidence GB. Honey with the paper rate. You can develop clinical validity, internal validity. You can how valid this is, how good the research is. The net offender come for external validity. Is this externally valid? New research makers, can you extrapolate? Can you use it to make good decisions. It's so difficult. I have been in my before today. But that means the invasive type they take a lot. So people should expect complications of Gambia. So that is a point. But the next one is not psychological or mental effects, mental health mental health ones, yeah. And now on to next. So you're invited to ask.
Mustafa, yenying kitabo menje Fazail Iman. Kitabo nying ngasanne dalilo men kama is.
Kadim was saying. Yes, Kadim.
Nying kitabo men alinya be nyimmen nateng is both in English and Arabic transliteration. I itandirol kele very, very clearly. Hani nyo sabate mento ka misilmolu karandi female circumcision nyanta kela nyadile. Nkoy ko misilme ya man fella mo kan atemen no la dunola. Misilme ya nana man kole ya kula musol kan, misilme ya nana man musol tora. Yalong alko kewlu kata nyaka kewlu kata kuyawto nyamen musol fana nyanta tala wala nyam. Alto nyal. Misilme ya wala. Misilme ya man kole ya landi musol kan.
Bamban tolmo fon
Okay, so demanding dulang explain. Nyinko, how female circumcision must be done Islamically. Anyanta kela nyadi le misilme ya la karola. So now, the all important question, what must be done in circumcising the female according to Islamic protocol? Very simple. Very simple. All that is required is to remove the bit of the wrinkled protective skin covering over her clitoris. That is what Islam prescribes. Islam ko inyanta wada malikala, which is prone to harboring the lubricating secretion. Ikafai ko smegma, S-M-E-G-M-A. When smegma is not regularly removed from the under the covering, it breeds germs and gives out bad smell. The skin of the female is very similar to the foreskin of the boy that is taken off at male circumcision. This is why the clitoris proposed has been described as the female foreskin. All the early Muslim jurists, all the early Muslim clerics of Islam agreed in one voice with regards to how circumcision of female was to be done. Other than this, anything that is done is not Islam. All that we need to do is to remove the prepuce of the clitoris, the fold of the skin covering the clitoris. Nothing more, nothing less. Imam Ibn Hajar al-Asqalani says in his book, in his renowned book, according to this writer, Ikafai Fatil al-Bahri, that it involves the removal of the skin covering the cockscomb-like structure and not the flesh. So,
what is called type 1A.
Exactly.
War is the least invasive. Wala la baramarota dawate beti daman ke symbolic content. So wala complication of dawate beti by implication.
Doctor, this is what
Doctor. So ataka me important. Ataka ideal situation la kana ata Islam lo for example like ideal situation la. But in the case Gambia fanya ideal situation wala bijeba. Statistic mo itandidi. So men ka kija kamol mantora. Luwala nyante lala jay stop. Mo beda.
And also
bari menu ka ke wol man standard soto. Protocol tije men nyan inventa kala nyame momo be ka ke fa yene be mol mantora ka. Stop.
But also Bamba, it may imply kanjang wala medicalization. So ngake in such a way that ko I safety come Islamia prescribe nyam ngake wanyam. So type 1A wala maybe type 4 wala pricking it because don't be jefon ibuka kunto in other countries ika come nga fanya makeup ika meleko ka press le tendoro. But even with that Bamba, it is a sino ya fonte any benefit. Tonya lem type 1 is not as invasive as type 2. But maybe Dr. Binafola Molian a psychological impact because a bit more trauma down there. Trauma down there. ani la moy bari yalon ke wolta yalon ni debbo muslimot ita mo muslimot fe o me yalon content we are worshiping ya safele ko ma nyanta kelal. It's not even ko hadith, it is iko it anyanta kelal is a requirement. It's not recommended. It's required.
Muso fananta is wajib.
No, Bamba, more for start la polo. Da mane o po jambam.
Let me quote this.
Hani Bamba da mane o po jam. Hani Imam Fati fanga mo.
Hani Imam Fati mo for Bamba.
Hani Imam Fati yer fata mo po jam.
Farlo le mu de ma fo farlo musol kunna de.
Ha.
Ko it is encouraged. Comme yake musol kunna pour Sénégal kamam. Ya encourage le. That's what I'm saying.
So then why force it on people? Why is it forced on people?
Nobody should force it on anybody.
Bamba ngamurun doro ngamung itela ideal wall itela lafta men na comme nga medicalize ning ko nga because mo jamal le ka nyim fo nga FGM medicalize nga the mall train nga symbol train. When you do that hanin ko what you are implying right now it be procedure le tan
mo fana implying
Bamba iko
Fatu iye me imply wo fo bari ntena me imply to fo no lan tele
okay afanye Bamba ite ko dino yenyi buko merit ay procedure le explain anyanta kala nyaming ha wala hani.
Yes.
Exactly. So you are implying from what I understand, you are implying a standard operating procedure. Anyanta kala nyame ite bole foka nyanta wala.
No, man ke standard operating kila ya mari nyame ente ka wala.
Exactly. But what is standard ti dino nata ni nata kila la side. What standard operating ti Bamba. Let's make it easy.
Menu ka fo ko misilme amantara hadiso to amantara fonko don ka wala refute ko afodro ite ma long.
Hani Bamba tambita hadisi tani tambita wala le ngata do into procedure sign. Hanna tara ko atol ko ngadomandim bondije type 1 is not invasive, right?
Okay.
Muso ni any sort of operation as a trauma dino musola. Bayri musol bijele mani alon ko type 1 ye wala soto. Ye domandi muso dol bije ni koy duntale buka alon koy duntal. Ni ma foy koy duntale tata alon. I've seen the pictures, right? Bari honey bee for summer, they carry those memories of trauma me along kabribe 5 years old, kabribe 6 years old, kabribe 10 years, singol yele nyamen kanyapi kan kanyunko kela hani sa beto. Ninke wakabe lale kan, it goes there, flashback or kanale. So you cannot take away the psychological impact me along ko ikasoto ni dunta nyakato. Whether type 1 lesoto, ye type 2 lesoto, wala type 3, it doesn't matter. Before the other thing is now ko nga medicalized the wrong. Bamba, you have to let me learn. Ninko nga medicalized dorong, it means kombe false safety leke kamba foka mole ko this is safe somehow, some way. And fengo me along kaka ham leke musobala, fengo me along ko is violating our rights. We cannot say ko wo a safe tale. It can never be safe. FGM can never ever be safe. Hanatera ko maybe se fenko stop nole infection or stop nole near fengo sterilized. But jumale bije member measure how much is small and how much is a lot.
That's
for you marrying I wele bang I wele ko ya fo jele ko gram nyingi ba ole bondi la je wala safety ate ko le doron domandi for skin hani menuka kewol la kase boyo ke itol they go with the ika sabale because nte bije biri bending ke odundi kam ika sabale itol ya feel damen dolta bije wala na dolta jama bondi dolta domandi ko
jibale to sambo
ndele tata kabri kan dingo samba
ike ma to
kabri kan dingo samba ndingolam I was there muna nanke manyata fotele mawlu jumale
to la kewlo fat baji bari billahi fat baji
it's at the discretion of the practitioner. Sai motije to hanatara ka atolia prescribe you cannot weigh that because wobe damento ita fono la nyingram le bije Dr. Ali Mako natara ko I'm getting it wrong ali
okay. So I think coming up on Femi Yalanka Bekele, whether or not low sonta or low man, so only 2% reduction with all this. 2% reduction, that means 98% people who are willing to do it are still doing it. That's what it means, isn't it? So Bombay means to just saying, let's train people. You went a step for the medical. Let's train the practitioners. I think training the practitioner does not mean you are promoting it. No. Because it's going to happen no matter what we do.
But you are promoting it, Doctor.
No, it's not. It doesn't mean,
Doctor, my question to you is...
what I'm saying...
Can you weigh what is too much and what is too little? Munem prescription what you want. For it about weigh no, do you have to cut and then weigh it and say, for it's just discretion of the practitioner.
Human anatomy, hani payat structures lom, hani most simple all, most injuful all, ibuka kanya yolon. Straight after the bit operation, remember in the bola caribala.
No, but doctor, can I come in here? Can I come in here?
No, doctor, so I respond wrong. Doctor, so I respond.
That's what I'm saying. Hani more blue full all, ibuka kanya. It's simple all, ibuka kanya. For every individual. So you cannot say, oh, this is enough, this is how much I should take. 1 gram, 2 grams, 10 grams. No. But what I'm trying to say, a place like Egypt, it's been banned in Egypt since 2007. But they are doing it in their hospitals. And they have a way around it. Even their educated people, their doctors do it. They take their children there. But it can be claimed by law, they just say, I want excessive tissue removed from my daughter. And they're still doing it in Egypt. And in Indonesia, they do it in government institutions.
And that's the problem.
Do you know those countries do it? It's not, they are not the only countries doing it. So
Doctor,
the fact that to say, to bring up a law that is not enforceable is not the solution to this.
Go, doctor.
But doctor, Dr. Letty, right? Dr. Letty, understand, Dr. Lakoto, you all signed some sort of a code of conduct, isn't it? That you are not supposed to do harm. Do no harm conduct. What sort of farm in your practice?
Yes.
So if you think that Konya FGM medicalized, ibe oilo code of conduct, ibati nyakan ne bang for iba strengthen kan.
Can I say, when I came to this country, my first job was at the UCLH in London. It was about gender reaffirmation. And imagine somebody from Africa, you come to UK and you see in surgery converting boys to girls and girls to boys and all those things, yeah? Yeah? Passing through that, and I saw how what people just need to say to get those very expensive operations on the NHS. You know, they are doing that, they do it still. People only need to say, I don't like my sex. It is disturbing my mental health. And the next minute, they go through a lot of psychological assessment. Then somebody will recommend that, yes, it's affecting the mental health. And they go through a lot of sessions. They start their hormonal treatment. And they are. The operation of Kibianko, they cost in excess of £100,000. And the government here are supplying it. Is that any benefit meant physically to those people? No.
Those are adults going to consenting and agreeing. This is a child. Normally, it has no health benefit. We've established that. Can you tell me for a health benefits of the pharmaceutical and it for your complication will be explained? Sign it as a doctor, your code of conduct sign. Equal, you won't do harm. And you know that what you are cutting this thing off, you can't measure it. Ntol mantara sharia bankoka. Ntol be democracy lakon. Ntol be mantara Islamic state. Itemo doctor yes signature okay. I'm just saying you, not personal. I'm saying in general, like if a doctor, right? So ite okay, but yalo no kombenye membo ndika nyim 5-year-old nyinto. Mba as a harm sort of as a psychological impact sort as a health implication also in future. Would you still do it?
That's what we are saying. So in the confines of law, yeah, or medical legal, consent is everything. A child, if you know this country, yeah, consent, there are 4 different types of consent. I'm not going to go through all of them. One is the adult consenting, who is capable of consenting, and anybody above 3 who understands, yeah? The other consent is consent 2, and that is someone with parental responsibility. So where the law stipulates, akoiko in the country where circumcision is allowed, female circumcision, a consent the number assigned. Now assigned, the doctor has every right to do it.
No,
what I said was Nimba mama nata dingo fe. Akoiko nyumbundingolati. Consent 2 felling sign. The doctor has every right to do it. So Gambia Panama ni mut nothing in Gambia legalized. nim parent ya ding samba doctor ya kaiko doctor nin samba la jakato doctor nin takelal by law. That's what we are saying. So what I said and what I think I've said it before, Purka ban is not going to stop it. And that is the reason people are going to be doing it in the back streets. And Nansimbal Bakela Stirminyanko, they are not trained. And a lot of occult things will be going on. Start like India, for instance, Ilanin Sati. People were jumping on their husbands. Dimbambe Malakampur Kale Janika Jumpakon. More connect after this did not happen, but they were still doing it. They won't stop. So human nature, what you do, you have to win the war of words. Don't use force on anybody. Try and stop. So come me understand.
Dr. Ntolbe agree to like education first for one thing, because honey in the West somewhere certain things sort of wrong. Like we do these trainings here, and sometimes law like na jandiba for like awareness. We are against those things and we are fixing it. We are saying you have to do those things, awareness and law economic simultaneously. Exactly. But what I'm also saying to you, Dr. Walanyintiko, it as a doctor, right? Even though you marry consent, you word consent for 4 types of consent, but ninga dig deeper, even at a deeper level. Consent from what is consent? Because consent yanta informal. Like you would not just say agree because everybody is doing it. Me as a parent, I can take my child because more baby can. Is that an informed choice? No. Informed choice. Well, I'm saying me along see telephone capacity totally. Kasika kuwa nyinjibe ye karandala le wala ifangole research ke or whatever, you have to be informed. And don't tell ngalo nembota society mento jama alfa mtol men ka ikan tol men samba community ko le nyinte amanke ko individual bama jamal bije, they don't want this to happen to their daughters. But because iboto community mentor wala tineka nyinke, because pressure nyi membe je and stigmatized, and they want to feel that they belong, because belonging is safety. So, but I'm left to case somebody because as a doctor, they go away with medicalization, because medicalization near medicalize, you cannot medicalize something is infringing the rights of people. Ibe human rights you cannot medicalize abe mola human rights because right to life bijel, right to bodily integrity bijel, right to good health bijel. For FGM good health letibam.
That is why the important thing comes back here. Can we stop it? The thing is no. Can we come up with laws? Yes, we will come up with laws, but are the laws enforceable? The answer again is no. So we have to mitigate. Mitigated here, that's what I'm talking about. Treat the people who are likely to do it. If it comes to even doing it in government institutions, well and good. If you're not happy to do that, teach the people in their homes on changing razor blades, individuals to one razor blade, and teach them what to do. Let them do it if they want to do it. That's the thing. So as much as we talk about,
if I may come in and ask here, in the Gambia, doctor, sorry, remember Malacheko.
No, Kida Fabugadem, Kadida Fabugadem, maybe I'll just give her to say something before she leaves.
That's very good. I like discussions are very good, People should.
Okay, ala baraka jinkata important because tena mul baby mo be back for kan bari abe different perspective na understand ni muli la mo yin katala. So mbal tendila mbal jaila. Dr. Barry binante dunte tarrajam bari iko be psychological fenkol fala jo important la jin PTSD, anxiety, depression inte da PTSD dinna mogala mo tan koba ta to binibe mol sambale mol sinle like sakul ikane koma ye nyasiti ye sam so kon telani adulthood hanen be sire office be sire dal mogala mo tan ko aka PTSD di molal so nyinna harmful kol wolle stiata la ben neata iko benefit bi gerento malo barala hala harmfulness wo stiata. So more base wolo nyama and coming fat baja nyama avec ko mol fang sometimes mol la kala fiki du mol samba community pressure wala kata la mol kam pour du mol samba so ala baraka baake ko wati do
Thank you.
Thank you, Kadi.
Suleiman, you were saying?
Yeah, Lima Bugona Lache Dr. Moy, when he spoke about consent, and I think FJ, is it Javi?
Baji.
Yeah. Mention about consent. Consent normally is rooted on informed, choices. So a 5, let's say 1 to 5 or even 10-year-old, kokunakala mo muna make an informed choice. Be muna rafa consent pour new them.
No, the responsibility is the parents.
No, but it's not the parent who is being circumcised here, it's the child. So child be, because yarami child be mom la utilize. So parent be do muna consent ne na nyobu sumadom, because the trauma that the child is going through henna komli kadiwa ñu la taka yobula o yaa ngi ñëw gis risa yi nga gis yeneen xale yi, even xam nga with pain bi dañ la dene bul joy. I remember even like myself biñ doon dem leel is like you went through the bush, amul ben anesthetic amul dara dañoo jël paakare ñu ne xoolal si kaw balaa nga lifin ñu dokko. So yaa ngi toog foofu yaa ngi bleed, xam nga métit bi, ñu jël ay foog na APC la woon ñu nga lifin ko tay ko sa yaram di after 3 or 4 days ga yóbbu la ñu génne loolu. So xam nga all that pain demuloo through ben anesthetic. So dañ la bul joyee, so joyee doo góor ak yooyu. So you have to go through all those things. So jigéen maa ngi imagine me as a man going through that, and xam nga xame woon naa tuuti
yow fu nga jógee Basse foofu dafa tànga man bul ñu sonal. Yow Basse dafa tànga loolu tàngaay jooy time boobu yu
man jooyu ma de, because man duma UDP, man duma lum tànga duma de yuhu.
Right. So what would that about it? To be fair, the conversation, the conversation is so interesting and interactive. And then so jërëjëf si sa contribution ba ma mëne nga ndawoon waaye ñëwaat nga affaire si mooy kacaɓe diyaare Mbake kacañi wulda mena kamma wolon ka mol fahamdi kula mimɓe denden ñing FGM la, because amu kulede miya lonko niya korasi kumin tata fo mol ka baramaje kumin tata fo mo aɓe jarala pour mol niyo e boje wo jartala pour que kacha jartala pour que mol faham dala on this planet. So womo fenne de mi alonko kacha ni wulta wala kamba par sa Gambia fela sa ko ila luala be loring pour ka je ko woy ke kuti mi alonko akana continue. So rodin kumbo nyama sain be min kela say yes, there is this. Okay, Aminata. All right, Aminata has been trying. Aminata youth, because Minkera Aminata ila internet connection is not stable. It's been going in and out. So it's been texting me to say, can I come in? Can I come in? But Ninkombe Dundila the wrong line or could drop line. I'm sorry, Aminata. She's been trying, a few times. Ala connection o mantra bedaring. Aminata Korea, yeah. But mami, yeah, Gambia can dollar jang day la gunjur fesiara barsabe is a problem. So mamin kala saying the momo bolaila Aminata, yeah, can you hear me? Can you hear me? Aminata? Hi Aminata. Right. I think Aminata, unfortunately,
hello, can I comment?
Uh,
it's
a struggle. So mamin kala more base we can come up with final thoughts, observation and resolution. Yes,
I can hear you. I just want to comment shortly.
I think Aminata is talking.
So what we can do, Bamba, so
because he's talking. Aminata, go on.
Aminata, go ahead. We are hearing you.
Aminata, go on.
Ala baraka bake memobe kontonna mbe hakadani la na internet wole bambetia. So on laptop mim fola rek wolen ko ngamira ntolbe we have a collective responsibility. Ntolbe nga responsibility lesoto nanata ndingol la karola. Pour kaje ko nanata FGM la karola mantoro minka keje adu ngaje musol ka fon tol kanyi mantoro lesoto. Akana lan dingol kan akana la dindingol kaminu kanana so ntol be yo collective responsibility la soto as parents and ngikita ko misnimeya man right di mola hanna tar ko itala wudu alfati ka foko isa man tola wala tinna victims soul they are very important into this pour nge lamoy e kamin kolya ko le soto na tara ko ntata nge samba nyaka amanda woto fanang lafta bamba lafte jabila do manding ila kitaboto lonnal ya fo salafol ya fo ko fazail amal yamin samanan most of the hadith mimbe je a wiktale ana daiftale you can make this research yourself so lafte jabila nun je do manding police wolong so lafta nyen do manding wala fayla je rek bawo time o tatale I was not online.
Abarka Aminata, sorry for the fenko. Yalong luwa fa nyanta kelale Gambia by force internet or luwa fa nyanta kelale. Abarka back Aminata for that.
No problem. Thanks for your effort, Aminata.
Aminata mbadunga Aminata respond to manding. Comme Aminata e memfo ala nyanto lemu yalong tol ko democracy.
Luwa ka niko Gafanyari and they niko luwa internet by force, you know, won de bakela mo floti le puka wo fenke luwa by force.
Because way
Sol kang internet luwa by force. Sol, your final thoughts, Balanyo them Sol.
Well, I think to be quite honest, Mansuma opinion is like people like Bamba, you know, they misinform the society about things like FGM. Hamga ñu ngi ñëw di code hadith yo xamne amuñ ben basis here and there. Li gëna am solo moy ñu ràññee ne li is not a religious thing. It was here before the advent of religion. Is a traditional and cultural way of life. So religion bi ñëw na daxu ko. So and time after time, nini because you practice religion alongside these things, you ne religion la. Amna yenn aada yo xamne ñu ko def dañ ko dé wéer ci diine bi waaye fekk moom mu fi before diine bi ñëw. So ñun góor yi ñoo war a dimbale suñ jigéen yi suñ doom yi because man suma doom bugguma mu dem understand I've come from a background boo xam ne ñëpp dañ ko dee practice suma sister si and everybody else waaye man personally I don't subscribe to it and loolu yaxut suma diine ci dara because as far as suma doom mu ngi practice religious rights am moom su demee ba magal boppam mu feel ne xen na bugga na koo def loolu choice am la she can do it as an adult so war nañu understand the implications the psychological and the physical implications as well as the health implications involved in this amuna ki ma doon waxtaanal is like lima wax na a lot of góor yi preference la daal understand so they can help stop this thing. I do understand so outlaw a lot of things, it goes in the background and then you would still practice it and then they would practice it in a more inconvenient and in a more dangerous way. Why alongside the law, mun nañu also educate guy, like involve these people. Won len ne li ni ak li la mo affecté nit ñi. Let's say for instance fi xale yi so lena support about henna ñuy taal kayit seen biir néeg yi o henna ñuy vape o ñuy tuuk seen biir néeg yi nga play leen video you know fire outbreaks in homes xam nga loo xam ne dafa starté very little ak live yi mokos borom su ko xoolee daf day real oh ndekete lii ak lii la moo def because xamuñ woon the implications so you show them some of these experiences of women yoo xam ne dem nañ through the process after effects yi gaay di am henna loolu dina help ngan simbaay ñu realize ne lii de definitely living henna suñ ko prick ñu prick ko but why would you even do it to a child ko xam ne ràññewul ndeyjooram ak càmmoñam that's my last bit.
Mustafa, are you here? Okay, Bamba, your final speech. Well, so
Thank you very
final
much, Ndeye. Mbe mbari muso jabila domanding yalong ntemanke salafoti wo mo bele wala mo Gambia de yalong ne ko Bamba mas surfi la ma manke salafoti Ntenin salafolu man ben ku jamale to. Ntenin salafolu man ben nyinto ko ni parita salola assalamu alaikum ke imanyanna alfatiyo tala. Ntoluka alfatiyo tale. Yalo misilme atatale for a janjanta kafta so many branches. Mari musoy kamem fo ko fazail ahmal salafol jama ya fole ko daif lemu amanke hadisol men yalon ko bambanta bake ntebe law kuma kango baylal salafol amanke ko ni woli mem fo misilme ato nyanta bulala wala noma hani ni ndani be kambending salafol jama bi jenni be kambending musol la nyi ko yandu talal ko molu nyanta karandale bari kafu ka ban ka bondi je ferem ntama wo support nte to nyala manke musoti musolle ka experience, and I must apologize to them. Bari yaje kuku fara ba kila men ko is deep rooted. Ni malla fi aita to the extreme. Comme menketa kuntauru because atarale lua yaje me aban la lua na tika ban. Bari molo ka ke duma. For until ya musomo ta kuntauru ya samba kiti wala ya alaman inata na ke big isuti. Me alonko it was blown out of proportion. Ndenga mira ndolunga opportunity le sort of sign as adults, as alifalu, as sutiolu, nga kwenye discourse nga kacha. Niajube bi heka to the Mustafa. Niajube Somalia Bangkoka 98% performs this female circumcision. Guinea Conakry 97, Djibouti 93, Sierra Leone 90, Mali 89, Egypt 87, Sudan 87, Eritrea 83, Burkina Faso 76, Gambia 75, Ethiopia 74, Mauritania 69, Liberia 50, Guinea-Bissau 45, Chad 44, Cote d'Ivoire 38, Nigeria 25.
Bamba, Eka was 36 old men quote. It does not justify this is right. No. Because Eka left me it and the mola because these people are practicing it. It's this in these numbers that makes it right to for others to practice. No, woman right. You are misinforming the public. Before Islam, Hani Muhammad Lawato, more Jamaica idol practice no. That does not make because they are practicing idol worshiping was right.
Suleiman. So it right now.
No, I wouldn't. No.
It very well. More begin your family.
I did recognize I come from a background, me alone practice me. But in dingo, and that's my point.
What are you going to do?
And that's Sambala Kidiola, but I will tell her my peace of mind because among rights sort of Purkana Dingo Samba. I la Dingol as well Samba no.
Go societal stigma membeje coming and they memfo. I agree with that. Because Ninde ma dimuso bondinjeno, Tony Banta Samba. Because more many are kamul dimul Samba without the parental consent. Ko mbari muso dingolment warang na sister dingolment waranto ndoma dingolment warang mama dingolment mbatu nga Samba ko wole culture nyanta bola. I agree with that.
What's Bono by us telling them the truth? Okay, educate. But if we stand here as men and we are trying to justify this thing is practicable and is right, we are entrenching
nobody is justifying circumcision.
So Anyanta Kumazela from the family heads because in the society finding Woleka decisional Jamal Ning. So Jama Eka Funda Muso.
Right, okay, Tol. Tol. Yeah, I know. Yalo ni mo flow is all cutting you all around but maybe saying, yeah, so I understand. So Bamba maybe saying Bairi Yela observation nila final thoughts fole ila miro ila jero ila fahamro nyimfanala akumada bake. Thank you very much, Bamba Baraka. So I'm saying
okay, it's about final thoughts. Then think on a final thoughts then I mean if it na I think until after men for la wole muko I feel so sad. I really feel so sad. Koku ning natara musol la kolem all the time. Nka downplay le. Anytime hanin nin na rights is abuse. Hanin tol nin kewol fango men katara kelola. Nkata kelola human right kelola. Nin musol la kol nata. Ika fole ko a okay tale. Ibuka law fa yafa ika lole kantol against. Ndenga wole jando akambalo fa bake. Katu ninde nin kewol men lota. Niye keloke for human right, for the rights of people, for Hadamadingo Bela rights, for Gambia Bela rights. Will you see koteke yentela right abuse? Ndela nyanto ya tambulu ngulita nko mbe wurila nko lafta ye makoi. Lafta ye si ininte fana ye kele yentela nyanto kele. Wo kewol fangole ka wuli koteke ya foko hani wote kela. Katu membe tela wole nyanta kela. Wakante balo fa le bake anu nga observe le meta fola akam balo fa akan mira jamale dina ninto sita nyim platform o kono nga foko nga corruption kele nga luwa dundi nga corruption o kele ninte la nyancho natanko alilo nga na nyancho kele katu ikamen kenna akantela dunia be tinyale akantela hajol be tinyale akante tinyale iko wo wote walk nola katu luwa niye mol balikula ikata dumale yake bari corruption o ninko mbeta nga kele nga luwa dundije wo mobu kata duma yake wo mu luwate because ay mol bele afek andu ngagnin treno jele so nte lafta men fala wole mu ko natara tonya mbeka kele nka foko human right nka foko nka mol la nyantole kele manya na jubel fo musolem nyinti fo musolle tamu nyinti fo kewolle tamu nyinti ni mo human right ya abuse dawo da is equal amanya na fisiala moti amanya na fisiala ko musolle tamu and wato wati ni aje ba fala kuman work kuman tano alinga mol karandi fo ya understand ni a jube musolla problem wala natara problem ya ko embe affect wo ngatariale nga wo implement ngatariale ngatara wo kono bari musol damma ni wulta dron excuse kana ni wulta dron atago kana ni wulta dron ntol ma understand ka memfo ni wulta dron ka foko ntol man kol karang ntol ta bondino la ati change la andu nin sitan ka foko han yelu akije ati change la wo mu defeat simleti ndenga woje defeat simleti because natara mbeya jenu wonya koni luwate tara nyin dunia kono mebu ga tara nyo fala ngata nga sinna sol kono nga nyobun kidola ngata siko bari neje luwal nata kanale pour ka kol tala so ndeba en la dameng I hope ko MP sol ite nyin repeal iba tula jele luwa tara je nga mor kalandi nga continue ka mol karandi andu lafta tribute di la tu gam ko trap isi ko be foye ye mol karandi le ye dokol kele itatali kata fo santoto nte fango nata holiday le yen samba dulalto nte nene mamira basol wolle be fede kan duman lata duma ni ngan simbal nyol we are talking anata holiday la yen samba wulol kono kayita ndibe dokol menkela ini musol kame nga beje nyala this was years back yes there is a backlash and wana nyanta wulila nga kukeje so mbafula again mbafula kewole nimteni melka low nka kele nga foko mbe Gambia le dadala mbe Gambia la nyantole dilala mba jube la Gambia regle ninte wulita wurita ko muso ko albari muso al musudoma albama al dingo lafta alfana ye wuli aninte fana ye kele na nyantola lafta wala fola ala barka
Baraka Ndeye.
Baraka, thank you so much. So Bamba, Epaji, have your final thoughts.
Thank you, Mustafa. I love that a member for Ndeye has actually summarized it, but I just want to say nying platform or opportunity be has been really helpful because it's refreshing pour people like Suleiman advocating pour adimuso wala ala sister kaje ko wolte dunna nyakato. That is actually refreshing. Also, it's been a learning puruntol nga moiroke Dr. Maya lonko ay impactol fo molen ne men ya lon ko nyaka to ta kam mantoro men di musola aliamo doctor la ya fola ko ning type 2 lem type 1 type 2 ko type 3 be a be mantoro sotole the more invasive it is the worse the medical impact but if fengo feng ni ake musola nyato to nyaka to tala karola among nafa soto ngawo establish ning conversation olo ko nafa tala among any nafa soto musola andun tol as parents nga responsibility le soto pour kan dingol protect pour kan dingol ka make sure ko ye access to good health sotale wo mu dindingol fanan na nyantol ti la human rights lan wati mbenga establish ning conversation otolo ko nyaka tota manke dino ti bayri dino ya tara janne right ado lem ada bambandingo bari fanan nata lonne ko ado ka falinne bayri hadama dingole ado dada nga ada dol tuno je nyame me ya lonko ngajila ka man nafa soto nye nse nyinya ka to ta fanan wo tano le ka tuje bayra man nafa soto musoy alay muso dada nyame is enough dino le ya fo mole ko nim fengo haniyata ko dino sontala natro ka na afengo nying is aka ham menka aka mantoro menke mola wala siyata ka nafa men di mola nka woku tujele dina kilingole ofo andu ngalo ne ko dinya nyata on kate tarlaje membe wo refute la mente sonnam ma wala because ntol fana nga kisi rokel woto fengo me ya lonko ado lem andu ado hadama dingola dada se falinole fengo me ya lonka man nafa soto musoye fengo me ya lonka mantoro le soto ntemen ka diamale ndunta nyaka to le andu nga fale ne ngamen experience mbe diamu kan National Assembly member so le sign because nyunko be tolle bulo kono nyim manke tubabo ti men ka diamale nte f mkuluta Gambia wuluta Gambia mkeba ate Gambia nata tubabu du janga ding sabasoto nyaka to ta wulu wonying ayem batandi bakel nga mol jefana nimmen ye doko ke from across the world nteni refugee ye doko ki janni musol everywhere te mira no dawdala ni ye doko ke men ya lon ko itata nyaka to le yela testimonial dinnale nga karanne nga natalol jele nga kisi roke Gambia le ngaji ko data soto ta me ya lon ko strong evidence lem ko nyin ko ka mantoro ke mollale woto ali songma comme de ye memfo ni nga lakelo nata nka wuli nga kele ntolle baliye dulal beto ntolle siyata Gambia musol sila ni musol la ko nata atol kaliye backseat ta woto atol kaliye control soto wo fananto aba koleyal so alsal hakilo to woto bake nyim manke culture nyim manke ado damati nyim mo la human rights le fananti aba wole violate ka na human rights nga rights to le puruka balu nga rights to le ka access to good health nga bodily integrity right fanan sotole even though cultural rights be but in culture ni human rights collide culture ka tuje le human rights eta and wo fana mu another right let me alon ka be saferine ko ali culture tuje many alon ko is harmful wo fana be saferine and Gambia is a signatory to that. Because Albe Deputy you guys should have gone and do those things. You're talking about cultural rights, but it will rights killing on Albe Memfokan. Human rights it's harmful and it's cultural. So what mbal Danila, amanke keloti. Nyo karandilo niaje molka emotional thing. Ndunta fenna kono. Fentije mentambita expert man tambif mome yalonko you lift it. Itele wo balu. Moti jang men se fem fonte nyaka to tato nsa songala because nga men balu na story lem ntela nga balu wotal sal hakilo to dulato bake aliye balafa aliya lon ko di musol le balbulu balle balbulu nga na dindingol protect wala yatina ngal vote in je mal vote je pour men diata to aliye oke alkanan tol balo use pour ka political scoring ki je to pour ka genske through politics. Because almang hani mansimbala, almang hani yai kompinola, almang hani merola, hani. Ning doctor wal ko ting, ni ye nyim bata dai, wala ke musola, alal hakilo to woto. Na pali ntol baby jannembe internet la, and we can talk, we can campaign. Na li nyim nyinta aliya repeal. Ntol fanembe tar la sirin jannem bal be korosikan ni. Because nten na karte keso dilala, because atol mantol la interest at heart. Ntol la ngal kije. Nim Gambia musoli step back into politics mote tarraje to house to alter tarraje in the first place because kewal buka finti back ka voting ke the evidence is there. So for once you are tested yet again puru aliya proof ko atol benying house to puru musol la nyato talla al mantara nying house to for alla own interest ntala kumo badanna wat ala baraka
Abarka bake Fatou, abarka. Dr. Natalie, Doctor, ila final statement, Doctor.
Thank you very much. Ninkete yam fonte for multiple fankatara to be in a franco discussing circumcision and complications and all not regarding I pace Minta Gambia in the last few days. Because na musol fa fanya kwenye nyumut heated debate let Gambia. So the thing is, parliamentarian, whether they voted to refute it or whether they voted to keep it, the practice is going to be there. And so for 100% I can say that, because human nature or what. But what is important, the complications will mean for Masakunda steps alter to ameliorate them. Abortions, abortion is still going on, and we all know it's illegal, and it morally is wrong, religiously is wrong, even humanity are happening. Nothing, no amount of law you can come up with member stopper, because backstreet abortions, which are the ones that kill, are happening because of government and legislature ban. People go back door and do these things and in kitchens, in nasty places, and we are losing lives because of it. So what I'm trying to say, Hania Condemn B is not going to go. So government must take good effort to educate people, many they want to do. Stop it. We are depriving some people of their basic human right. And if you want to come up with any draconian law, people will go underground and still do it. So they are the way forward, knowing all the medical complications. The greater majority of the time, obviously, yes, but the little me for them is 100%. Na system in PTSD, so she's living and it's sad. And for it's sad. There are other people being careful of you know. But Kobe ameliorate Masakula has to take a step. And the step will be teach more, let learn more. The people who want to do it, because we cannot stop them doing it, to sanitize the area, make it less risky. But you cannot say it's going to be risk-free. No. Make it less risky. So the ball is in the government's court. Banning it, to say we are banning it and so we will not help, is a no, as far as I'm concerned. So Ngame last word. The other thing, I'm very grateful for all the other, for the host and all the participants. Very nice on contentious issues like this. And thank you all for your help and your understanding. I hope mom will offend in any way, means it traumatized, you know. Thank you very much, everyone.
Abarka bake, Doctor. Allah abarka bake for your insight and expertise. Allah abarka bake. Suleiman Fanang abarka bake. Mustafa Natalie. And Fatou Baji, Allah abarka bake. Kadi, Allah abarka. Sorry with Aminata Kore, Memandu Korea, Memandu no. Allah barka bake, Bamba Mas, abarka bake, and Benyojela next week in another topic. But Allah barka bake, Nina Mudoron Fonga Diamunga cool Fene and Nyoya cool understand. Mustafa, over to you. Do you have something? Ika moile Mustafa. Ha Gambia le maka time tale jannabe futala Mustafa ya I come back to us. Internet.
Nay, woto alenga advocate ko ye referendum ka kola, because we don't want a situation where the Victorian vote to keep it yafo is male dominated. Yalo musola kola. So woto alenga samba through a referendum.
But it's late for referendum now, because if they are putting it, they're going to next reading is on the 18th, so it's late already. So we'll have to wait for the results. It's too late. We wait for the results, Najube. Hopefully they will keep the ban. Yes, Allah Barkabake. Mustafa, I think Mustafa is having internet problem. So he needs to log us off here. Because of Mustafa Begambiale, internet connection will kata on and off. So he's trying to log in twice. Hey, it's not easy with the internet. Mustafa, okay, everybody has said their final words, Mustafa. So would you close?
All right. Okay, that's fine. Budun lamana ni jiberal mo betawra ni be watu watu you know lokum program o menka so the governance Sky Power radio and TV services be mo be tentulam be jela watu ensenyina la medana la janna posibit nala inshallah program o nyin kana sibito sibit rek ka tral lulu kara talam gorawla panel sol be tentulam be jela be ndelo moderator ti nei yakara bake idim bara be tentulam be jela baraka aning sol aning honorable Bamba Serigne Mas Bamba Mori Balde Serigne Bamba e Dr. Yang sino sabi jengolo mateti wodron no mala problema de barni wonde bin dara sabi jile bi adura bulende bi adure la broda bul bakela bi
I ente jomal
Brum mesaro di la lambe dana jenne possibility nala inshallah kamana Skype or radio and TV services on al badi malo Mustafa Jame possibility nala inshallah alimbara
ya abarka wake doctor abarka wake